books is in. The books are in. Yep. They in. They here.
Log in to KofiPaisaTV.com and get Spears of the Mossy Volume 1 by Kofi Paisa Research Team, from Spears the Pen Volume 2 by Kofi Paisa Research Team, Spiritual Combat Volume 3 by Kofi Paisa Research Team, One Night Before Bed by Any Harek Shawn Calfunny, Kalawa's Trip to the Motherland by Kofi Paisa, From Cocaine to Consciousness by Any Harek Shawn Calfunny, As I Learned, We All Learn by Kofi Paisa. Also, if you want fresh merch, go to our online store, Family Connect Apparel, and get all the brands. Also, get our 54 deck of quiz and educational cards available now on KofiPaisaTV.com.
ETM Hotel, Rennie Shawn. Welcome in peace. My name is Shawn. I'd like to thank everybody for tuning in to Science with Shawn. Good evening. I hope you're having a blessed day today, and that your weekend is upon you and approaching. Tomorrow I will be getting my vaccine. I'm getting my vaccine shot tomorrow. You know what I mean? I'm a little excited about that. I'm gonna try to do as much as I can to bring forth the information. In worst case scenario, I'm gonna have my call on deck once I get my shot. And yeah, man. So I'm gonna get the vaccine and then I'm gonna get me a haircut. Yep, that's what I'm gonna do. Vaccine and a haircut. Yeah. So again, like the show, share the show, tell a friend, we live. Let's get some people in the building, man, and so we can have a little fun. Hold on 1 second, let me do this. All right. Let's see what we got in the chat so far. Peace, number one troll. I see Tika in the chat. Peace, sister. Sutek in the building. Double R, Robert Rand in the building. Peace, sister Bonita. I see you in the building as well. Everyone who may watch or catch the replay, peace to you. Yeah, Sister Bonita says she's still nervous. I ain't nervous. I'm excited. I'm excited. Shoot, I could have had this dang on vaccine a month ago. Knowing what I know. Double R crazy. Yeah, man, like the show, share the show. We're going to keep it informational and inspirational. You know what I'm saying? You see the title of the show, The Attack of the Nanoparticles, COVID-19 Alert. Just want to let y'all know, man, we're just going to have some just a learning experience. But first and foremost, let's deal with some recent news that actually came out about AstraZeneca. Hold on 1 second, y'all. I'm going to get this in. Yeah, AstraZeneca is some news in making news. Breaking rules, making news. All right, I think everybody either sleep or booed up. Let's go. So, should be able to see my screen here in just a second. I might need to go jogging tonight. What's the temperature? What's the temperature outside? I can do this in Get my jog on. 70. Yeah, I'm going to jog. What up, Thurman? What up, Juju? Yeah, I'm finna mess with y'all for a little bit, then I'm gonna suit up and go run me a couple of miles. I've been begging. About time we covered this subject. You don't even know what I'm finna cover. The nanoparticle thing I already been covered before, Juju. So that's crazy. Yeah, it's 73 degrees outside, so that's good running weather, especially when I put on Under Armour and my leggings and my hoodie and yeah, jogger pants. It's gonna be like 80 something under that joker. But let's deal with it. So Denmark, Norway, and Iceland suspended. I ain't letting whoever just join on the panel yet. Oh, that's what
So,
Also, the
so,
boys,
not much. Where you at, a track and field game?
yeah. You know it.
in seventh
Who,
place,
who,
Out here
Brandon Ford.
in the
who,
wild blue yonder. What's good, bro?
not much.
Sixth
Not
place,
much,
Nick
man.
White.
Y'all winning?
Huh?
Y'all winning?
Man, I don't know.
Antonio Bishop.
It ain't like it used to be. It's crazy.
Yeah,
Gotta add
yeah,
it up. Gotta add it up.
yeah.
I know what
Okay.
you're running.
I see the white now behind you.
Yeah, they up in there. I'm trying to stay away, boy.
Yeah, they ain't got no mask on.
I know, yo, it's crazy. They don't know how to lean on that curve. Some of them do, though.
How they do? Oh,
Yo,
okay.
the white girl banging them.
She banging them.
Yeah, killing them.
Ah, that's what's up. They gotta learn that form, man.
Right. Shit, ain't nowhere in the world, yo. You know the rule, yo. If you let a white boy beat you running, yo, you need to work out. You let it go. Get out that sport.
Get out of this sport.
Yeah, that shit ain't true, yo. They be looking good out here. Everybody be running hard, though.
Yeah, that's what's up right there.
Yeah, you ain't gonna play the color card on this one, yo. You either gonna be in shape or you not.
Right. That's a fact.
Mm-hmm.
I'm gonna do me some running, man. I'm gonna get this in real quick. So before we even really want to get into the bill, though, can you explain what nanoparticles are to Julanda? Cause she interested.
Jelana don't know what nanoparticles is?
Nah, she don't know.
Lipid nanoparticles. It actually carries a messenger. It's like an oil, and it takes it to its desired area, right? And it's so smooth because you ain't got no chemicals, none of that. But it's just small particles, smaller molecules, right? What they call it, nanometer.
Yeah,
Yep. Mm-hmm.
real,
Yep.
real
Less than
small.
100. Yeah. So it actually is just something that actually carries. It's like a bubble. It kind of carries the particle to where it wanted to go at.
Yeah.
Real simple technology, and it took them a minute to work on it and get it straight. Yep, but now they got it. It is what it is. I'm going to get mine Saturday. Yep, but they use that. You know, they was approved in cancer drugs a few
Mm-hmm.
years ago. Yep. So it ain't new. All that is misinformation. Yep, and it is what it is, man.
Yeah. So I was getting ready to get into a topic about Denmark, Norway, and Iceland.
Okay.
AstraZeneca. Let me see. I think people can still see my screen unless I got it on you.
Didn't they shut it down? They shut it down.
Yeah, they shut it. They shut it down. They
What
had
that
to.
mean? That means signs
Well,
work, don't it?
yeah, because someone developed blood clots.
Seventh
Okay.
place,
So
Miranda
Yeah,
Ford.
they suspended it because someone developed blood clots and they needed to understand more.
so what they supposed to, you just let it keep going?
Right.
People crazy, yo.
In fourth
Yeah,
place, Amani
but they only suspended it for 14 days though.
third place,
Right,
Laura
but they still
Massey,
suspended and see what's going on for the safety
Yeah.
of human beings. Yo,
Jade
that's
Mhm.
that's science, man. That's what it's supposed to do, man.
place, Emmy Miner,
Yeah,
Yeah.
you like a recall and shit. And people saying, "Well, hold on, man, that's my body, man." Man, you talking about millions of people that died already.
Right.
Yeah, they tripping. Millions of people that died. They running
So they
slow.
got more than 11 million doses administered in the UK. So they held up They held it up for 14 days so that they can do some testing and all of that stuff.
Mm-hmm. Mm-hmm.
But that's pretty much what this article is saying. And
Okay.
my bad, y'all, for zooming it like that. But yeah, I wanted to get that to the people so they can understand. So they said a batch of 1 million doses went to 17 EU countries.
Mm-hmm.
And there's nothing to indicate that the vaccine causes this type of a blood clot. However, they just got to verify and do their research and they work on that. So they halting it up.
How many people got blood clots?
Not many. This is rare. They look, and Spain didn't register any cases of blood clots. The Danes didn't either.
I mean, people that's
The
looking
Danes
not to
almost
do it,
vaccinated.
huh?
The Danes are almost fully vaccinated.
Oh man.
Their country are almost fully vaccinated. They like Israel.
Of the girls, 800-meter run.
But they basically said is a number of I always mess this name up. Thromboembolic events marked by the formation of blood clots. So remember when we had the dude in Florida, the physician in Florida who developed the ITP and he died. That's what this is pretty much, that thromboembolic events. So 22 cases reported among 3 million people. So that's pretty much that, that's the science on that. 22 out of 3 million developed this type of rare thing. So they're just doing their homework on that. So I dropped that in the chat for the people. But that's dealing with AstraZeneca. So you had only one ITP response, and that came out of the Pfizer vaccine, and that was a physician in Florida. All right, so on to some more interesting things. Let me see. Do I want to go there? Yeah, so I want to deal with two things here, right? I want to deal with both of them dealing with nanoparticles. So Aunt kind of clearly explained what nanoparticles is. So I want to talk about something that bring up an old article that was actually mentioned. And this is the dealing with MERS, right? Showing a study basically regarding this from 2017, but I really don't want to speak on this. It's this trial that they had going on since December, which is a phase 1 and 2 trial for SARS-CoV-2 recombinant spike protein with nanoparticle vaccine. And in this, and I want to make sure that y'all clearly understand the background for this nanoparticle, or the NVX COVID-2373. That's the name of it. The vaccine is a recombinant severe acute respiratory syndrome coronavirus 2 nanoparticle vaccine composed of trimeric full-length SARS-CoV-2 spike glycoprotein and Matrix M1 adjuvant. So y'all know what an adjuvant is, right? So it says methods. We initiated a randomized placebo-controlled phase 1 and 2 trial to evaluate the safety and immunogenicity of the SARS-CoV-2 vaccine. And with observers unaware of trial group assignments, 131 healthy adults in phase 1 vaccine compromised 2 intramuscular injection 21 days apart. The primary outcomes were reactogenicity laboratory values according to the FDA toxicity scoring to assess safety and IgG anti-spike protein response. Now, the secondary outcomes included unsolicited adverse events, wild-type virus neutralization, and T-cell response. Now, the IgG and microneutralization assay results were compared with 32 and 29 convalescent serum samples from patients with COVID-19, most of whom were symptomatic. We performed a primary analysis at day 35. So here go the results. After randomization, 83 participants were assigned to receive the vaccine with adjuvant and 25 without. And 23 participants were assigned to placebo. No serious adverse events were noted. Reactogenicity was absent or mild in the majority of the participants, more common with adjuvant, and of short duration, like 2 days. One participant had a mild fever that lasted 1 day. Unsolicited adverse events were mild in most patients. There were no severe adverse events. The addition of adjuvant resulted in enhanced immune response, was antigen dose sparing, and induced a T helper 1 response. That's a good thing. The two dose 5 UG adjuvant regimen induced geometric mean anti-spike IgG and neutralization response that exceeded geometric mean response in convalescent serum from mostly symptomatic COVID-19 patients. We're going to clear this up. So I know I went over a bunch of people's head. In short, at day 35, the vaccine appeared to be safe, and it elicited an immune response that exceeded levels in COVID-19 convalescent serum. The Matrix M1 adjuvant induced the CD4 plus T cell response that were biased toward the Th1 phenotype. So, and this study just breaks down everything that they actually did. They are trying other vaccine types, and they are on the way. So you had a successful phase 1 and 2 trial of the spike protein nanoparticle vaccine. Oh, I see you, Unc. That was your daughter?
No, hell no.
Son?
My daughter already finished. No, hell no.
You just showing them get on down.
Yeah. My
Okay.
daughter be looking smooth out that motherfucker.
She was?
Yep. She tall, yo.
Okay. Yeah.
I'm gonna post it on YouTube one day.
Yeah, do that. So that was a phase 1/2 trial that's available in the actual thing. They're just letting people know they're still working on other vaccines and things of that nature to try to improve upon getting people vaccinated, but also alternative vaccines. You know what I mean? Because some people got an issue with the mRNA, they're gonna hit you with the viral vector. You know what I'm saying? You got an issue with the viral vector, then they're gonna come with a recombinant spike protein nanoparticle vaccine. So they're gonna come with multiple solutions, and then they're gonna hit you later on with the nasal spray. All right, so both of them can be found in the description of the video. Another interesting topic was I'm doing this now for the slow people. Here is a case, an introduction to 2 prolines and removal of polybasic cleavage site led to a higher efficacy of a recombinant spike-based SARS-CoV-2 vaccine in the mouse model. Ladies and gentlemen, what you see on the screen is a mouse model, meaning that they are testing this on mice, not humans, but mice. All right, there should be a very familiar name related to all of us who is an editor on this. His name is Vincent Raccanello. We all should know who he is. He is a part of this research. Shout out to Vince. Now, I don't want to give you the abstract, but I give you the importance. It's a vaccine for SARS-CoV-2 is urgently needed. A better understanding of antigen design and attributes that vaccine candidates need to have an induced protective immunity is of high importance. The data presented here validate the choice of antigens that contain the PP mutation and suggest that deletion of the polybasic cleavage site may lead to a further optimized design. So to get into this thing, you had Vince talk about it the other day on the show. I went searching for it, of course, to get it. This was some good stuff here, dealing with this mouse, with mice, I should say, with in particular a mouse. And you know, they basically went in and got what they needed out of it, because you're dealing with a recombinant spike-based SARS-CoV-2 vaccine. So I might as well tell y'all a little bit more about it. But the spike of the severe acute respiratory syndrome coronavirus 2 has been identified as a prime target for vaccine development. The spike protein mediates both binding to host cells and membrane fusion, and is also so far the only known viral target of neutralizing antibodies. The coronavirus spike proteins are large tremors that are relatively unstable. a feature that might be enhanced by the presence of polyabasic cleavage site in SARS-CoV-2 spike. Now, the exchange of K986 and V987 for prolines has shown to be stabilized the tremors of SARS-CoV-1 in the Middle East respiratory syndrome coronavirus spike proteins. So they test multiple versions of a soluble spike protein for their immunogenicity and protective effect against SARS-CoV-2 challenge in a mouse model that transiently expresses human angiotensin converting enzyme 2 via adenovirus transduction. So, I mean, adenovirus, I should say, pronounce it right so you can understand. Adenoviruses are adenovirus transduction. So you're talking about viral vector, adenovirus vaccine. You're dealing with that realm of what they got now. Variants tested included spike proteins with a deleted polyobasic cleavage site, proline mutations, or a combination thereof. Besides the wild type protein, while all versions of the protein were able to induce neutralizing antibodies, only the antigen with both the deleted cleavage site and the K986P and the V987PP mutations completed protected from challenge in the mouse model. So they're doing research, they're gathering information, you're dealing with this new type of potential new type of a vaccine in the making that's going through animal testing right now. And because we mess with Racanello, you know what I'm saying, we're gonna get the head start on the publication regarding the research, and I'm sure as the days go by, more research will become available. This article is also in the description here, and of course, this is going to let us know more. This is a study that started not too long ago, so we could catch it through its whole phase. So as the results show right here, this thing is in full effect. Now, something else. SARS-CoV-2 total and subgenomic RNA viral load in hospitalized patients. This is also in the description. I think we all should be pretty much familiar with this as well. This is understanding what the viral load in patients affected with SARS-CoV-2 is critical to epidemiology and infection control. And, it basically talks about, as it says, previous studies have demonstrated the SARS-CoV-2 RNA can be detected for many weeks after symptoms onset. The clinical significance of this finding is unclear, and most patients likely does not represent active infection. So I'm gonna leave this reading up to y'all regarding these articles. I do want to go ahead and stress there is a research question that I'm more interested in regarding all the vaccine science that we talk about. And that question is simple. Will the mRNA vaccines protect against COVID long haulers? Will it help protect, defend, and fight off COVID long haulers? Meaning that, these people that we know who've been infected with SARS-CoV-2, COVID-19, that are long haulers, right? Showing implications. Will the vaccine help reduce their issues? Now, some science has already came out regarding it. They haven't spoken too much about it, but they have said that, as far as COVID long haulers go, people who have received the vaccine have shown a reduction in, their issues with COVID-19. So this means you could be receiving a vaccine that could help you fight off your little long-term effects. But we got to wait on the science, and we can't predetermine if that is actually the case without evidence. But we do know that people are actually having this conversation, and that's a good thing. I want to give me 1 second, y'all. I want to get into something real quick. Just give me the doggone nasal. It ain't gonna be no different than you getting the vaccine, Benita. So I don't know why you tripping on that. You better get that vaccine, man. Quit playing. I'm finna go get the vaccine tomorrow, so I don't know what you tripping on. I know you already had that headache. I know you had a brain fog. I know you had all that stuff. See what I'm saying? You had that already, so you might well go ahead and get the vaccine. The nasal spray ain't gonna be for you. That's a long ways away. It's a long ways away. You can get that out of your head. Nasal spray ain't gonna be for you. You can quit complaining right now. Go on and boss up. Let me try to get this up. All right, hold up. That's the no, I don't want to do that. I want to take the time out to play an actual video for y'all due to the Fair Use Act and all of that, and just so you'll have a little understanding or something. Woo. Let me find it, y'all. I'm 70-30 on the vaccine. I'm 100-100 on the vaccine. I tell you what, since you 70-30 and you already been infected with the vaccine, go ahead and you know what I mean, catch it again. Let me ask you this, Benita. Do you want to go through what you went through before? Again. Mongo, no updated news on the nasal spray, man. I think that's gonna be we are ways away from that. We are like a ways away. Let me see. Okay, so if you don't want to go through that again, Benita, then what's the hold up with the vaccine? What's the hold up? Swole up. You better get this vax. You better get this vax. I'm trying to find something interesting for y'all real quick, man. So I'm gonna play this video. It's about a month old, but I find it useful because any little data that we get is always useful. Now the video is only 3 minutes. You know what I mean? And I'm gonna share it with y'all. And then, you know, we're gonna get into some Q&A stuff.
Hello, I'm Dr. James Hildreth, president of Meharry Medical College and an expert in infectious diseases. I'd like to talk to you about the exciting news about the vaccines for COVID-19. The vaccines are likely to be approved by the end of the month in December, and they're going to be widely available by next spring. I know a lot of you have apprehensions about the vaccine, so I'd like to make a few points that might assuage your fears and give you more confidence to accept the vaccines. The two vaccines that we're so excited about right now are called messenger RNA vaccines. So the blueprints for all of our proteins in our bodies are locked in the genes in DNA. But in order to make proteins, a working copy of those blueprints have to be made. And those are what mRNA represents. They're the working blueprints for making proteins. And in this case, it's a blueprint for the viral protein called spike. Spike is the protein from COVID-19 virus that allows the virus to get into our cells. And this vaccine induces antibodies to be produced, which bind to that protein and keep the virus from infecting our cells. One very important thing that I need everyone to know is that when you get the vaccine, you're not getting infected by a virus. You're getting exposed to a protein from the virus. So your immune system is making a response to the spike protein, and therefore it's going to prevent the virus from infecting cells and spreading. So you're not getting infected, you're getting exposed to a virus protein to teach your immune system to respond to the virus if you do get exposed to it. So that's a very important distinction to keep in mind. I know many of you have concerns about the side effects of the vaccine. What we've seen so far is what you'd expect from vaccines. They're the same side effects that we see with other kinds of vaccines. There's going to be soreness at the site of injection that might last 12 hours to a day. Some people get headaches. Some people get a fever, just like, in fact, if you've gotten infected and there are mild symptoms from the infection. But you're not getting infected. You're getting a protein from the virus. That's the main difference. It's going to take some time, honestly, before we know the long-term adverse events from the vaccine. But as I said earlier, the mRNA technology is new to vaccines, but it's not new to medicine, having been used since 1992 in the treatment of cancers. So as far as we know, the vaccines are extremely safe. They work across all age groups that have been tested down to the age of 12 years old. They work in people with pre-existing conditions, and they appear to work very well across all racial groups. So the bottom line is that we need these vaccines so that all of us can get back to a new normal, social interactions, shopping without fear, gathering in large groups. None of those things can be done unless all of us or most of us accept the vaccine. So I just want to let you know that the technology is new to vaccines, but it's not new to medicine. The vaccines are proven to be very safe, and we can say that with a lot of confidence because 44,000 people have participated in the studies of these vaccines. So I encourage all of you to do your part to put this behind us and really think seriously about accepting the vaccine for COVID-19. For those of you that like more information about the vaccine, please go to the covid19.nashville.gov website, or you can always go to the CDC website for more information about the vaccine and getting vaccinated. Thank you.
That was for Benita, mostly for Benita, y'all. That one for the rest of y'all. You know what I mean? That was pretty much
play into
directly
this.
for
I've tried as a
Benita, so she could actually get into understanding what she's dealing with. So, you know, let's get into it. Let's get into this conversation. This was done in December, but I just want to play out a couple of little parts of this because I want to get into Dr. Hilda's presentation. I think he did a really good job.
We're grateful to have him tonight, and thank you, Meharry, for partnering with us. And now, Dr. Hildreth, I turn it over to you.
Thank you. I'm James Hildreth, the president of Meharry Medical College. And tonight I'm going to talk about the biology of the virus, how the vaccines have been developed, and give enough background information so that I hope all of us can make an informed decision that will result in us taking these vaccines. So let's get started. I always start my talk by referring to Martin Luther King, who said of all the forms of inequality and injustice in healthcare is the most shocking. And I totally agree with that. And we need to view the pandemic in that context. So the virus that causes COVID-19 is called SARS-CoV-2, and it's a member of the coronavirus family. It's a large family of viruses. That's almost 40 members in that family. They're endemic to bats, but 7 of these viruses have an affinity for infecting humans. You may know that in 2003 and 2012, there were 2 other coronaviruses that caused pandemics around the globe. Some of these viruses, as you see on the right, have been circulating since the 1960s. These are viruses that cause a common cold. And because they are genetically similar, there's actually cross-reactivity between these viruses that belong to this family. You may have heard people talk about cross-reacting antibodies. This is the basis for that because they're all genetically related, which means that some of their proteins share similar sequences and shapes. One thing to know about coronaviruses that infect humans, the ones that cause pandemics are examples of what are called zoonotic infections. These viruses require an intermediate host that are animals. And in the case of SARS, it was these small handheld pet privet cats. In the case of MERS, which happened in 2012, it was camels. So unless you came into contact with one of these animals that had the virus, you did not get infected. And these are great examples of zoonotic transmission. Another great example is avian flu or bird flu. When people come into contact with birds that have the flu virus, they get infected. And again, this is known as zoonotic transmission. The major difference between SARS and MERS is the following. There is still an animal vector that serves as an intermediate host, but once the virus gets into humans, SARS-CoV-2, something additional happened. That is, the virus adopted for human-to-human transmission. In other words, we became the vectors for this virus. We didn't need animal intermediates anymore. So the main difference between MERS, SARS, and SARS-CoV-2 is that we have become the vectors for this virus. And with international travel and people moving freely around the globe, that's why this virus spread so quickly around the globe. It's because we, in fact, are the vectors.
All right, so do y'all understand that? Because he was saying this last year that we have become the vectors for this particular virus. So everyone need to understand this part of what he's saying. Because when you're doing the research on where this actually comes from, this explains it to us. And now we are the vectors
for this virus. The other thing that's really, really important to know about the SARS-CoV-2 virus, it is a truly airborne pathogen. What that means is you don't need to sneeze or cough or expel droplets to transmit the virus. The particles are so small, they're less than 5 microns in size. That means that if you stand in the presence of someone, have a normal conversation for more than 10 or 15 minutes, you can acquire the virus. And that is one of the other differences between SARS-CoV-2 and other respiratory viruses, because it's truly airborne. It does not require coughing or sneezing. Just a normal conversation is sufficient to transmit the virus. And that is why all the focus has been on masks. Because as you can see from this illustration, the infected asymptomatic person on the left at the top is able to transmit the virus to the 2 individuals on the left. But the one with the mask on has a much lower risk of getting infected by the virus. At the bottom, it shows you that if both people are wearing the mask, you have the minimum exposure, because whether you're the infected person who's exhaling the virus or the person who might inhale the virus, the cycle of transmission will be broken. And this is why masks are so very important in the case of SARS-CoV-2, because it is an airborne virus. Just want to speak briefly about the other thing that distinguishes this virus from some others is the spectrum of symptoms that are manifested when people get infected. One of those being the new loss of taste and smell really reflects this in a very dramatic way. There are few other infectious agents that we know of that can do this. But the point is that there's so many things about COVID-19 and SARS-CoV-2 that are different from the other viruses that we deal with. And one of them is the broad spectrum of symptoms you may get.
Hold on real quick. Richard White, can you re-ask your question? We're confused in the chat. We're trying to, follow the video, but at the same time read the chat. Some use the total numbers of deaths, others use the deaths of people who they personally know. Because I didn't get confused. So basically what he's telling you is that you could you could be in front of somebody and talk, And if you have the virus, you're going to transmit it. Even if you got one of those cloth masks on, it's not a guarantee that it's protecting. It slows down transmission. Doesn't prevent transmission, it slows down transmission. So this is why Fauci is saying wear 2 masks, or you need to wear masks that tightly fit your face, because that slows down transmission and it reduces the looseliness, you know, where you got the potential of particles going left or right, up or down, depending on what type of mask you're wearing. That may be too big for your face and not form fitting. But if you have 2 on, like you seen, like Unc wears the one he had on that we just seen, right? The little white one, the KN95. I wear one of those, and then I still wear a blue one, a hospital mask, so to say. So that's the way we go. But I'm not fully understanding what you're saying. I see the percentage numbers of getting the vaccine amongst Black folks. Is that because of scientific literacy, amounts of deaths, or the promotion to the vaccine? Okay, so the percentage numbers are increasing because Black folks are witnessing deaths. There is a literacy campaign going on, and so you could take both of those into account: literacy and deaths, but also infection and long haul. And then some use the total numbers of deaths, others use the deaths of people who they know personally know. Yeah. So, okay, all right, we cool. I had to go back and read it a couple times.
For GI symptoms, vomiting, diarrhea, fever, chills, the usual cough, shortness of breath. But in addition to that, we have muscle aches and the loss of sense of smell and taste. The other thing that's really important to know about the SARS-CoV-2 is the spectrum of the types of infections that it can cause. And we can have pre-symptomatic and asymptomatic infections. On the far left, I just want to make the point that when the virus infects the upper airways, it can begin to replicate in the back of the nose and the back of the throat. And enough virus can accumulate to be transmitted. And that results in pre-symptomatic or asymptomatic infection. When the virus makes its way down into the lower respiratory tract, the lungs, we get the release of these chemical messengers called cytokines that cause lots of cells to come into the lungs. The inflammation is tremendous. And in fact, the response to the virus begins to do harm to the body, just like the virus does. And that's because the virus is causing the release of these chemicals.
Now, you remember we had the brother on the other day, Ashanti. He was talking about a cytokine storm, right? He's saying that was the reason for deaths and so on and so forth. So I want y'all to pay close attention, because that's really, he tried to run a game on us with that. But watch this. Let me start it over real quick.
That cause lots of cells to come into the lungs. The inflammation is tremendous. And in fact, the response to the virus begins to do harm to the body, just like the virus does. And that's because the virus is causing the release of these chemical signals that cause the immune system to really go crazy, go berserk. We got inflammation, we got cells. So that is why in the late phase of disease, we get the severe acute respiratory syndrome. And that's what SARS stands for, by the way. So let me just say a word about the pandemic, because this is very significant. In the span of 11 months, SARS-CoV-2 has eclipsed the total number of people that have died from HIV. Because the 75 million people that we know to be infected, we can multiply that number, because for every person who's diagnosed, there's probably at least 3 or 4, maybe more, who go undiagnosed. So it's very clear that in less than a year, this virus has infected way more people than has been infected by HIV, which has been a pandemic for 30 plus years. The other thing is that even though we represent less than 5% of the global population, the United States represents at least 20% or more of the cases and the deaths around the globe. And this is a very startling thing, that a country with 5% of the population has 1/5 of all the cases and the deaths. And the reason for that is just being quite honest. The pandemic has been handled poorly at the national level from the beginning. And part of that problem was that the agencies responsible for dealing with the pandemic were handcuffed by politics. And I will leave it at that. But in a counterweight to that has been that the scientific response, the global scientific community has responded to this challenge in a way that we've not seen before. The other thing that's really, really encouraging and significant is we've had the kind of collaboration between pharma companies and public agencies that we've not seen before. And that is one of the things that has brought us to the point we are tonight. The fact that we've had this global scientific response and the collaboration between large organizations, including pharma companies. So the picture in the United States is not a pretty one. And as of December the 17th, we'd had more than 17 million cases of COVID-19 diagnosed. And keep in mind that most experts believe you should multiply that number by at least 4 to get the true number of people who've been diagnosed with COVID-19. We've also on a trajectory, I think we've already passed this, of having more than 300,000 cases per day. Imagine 300,000 cases in a single day. And we've also eclipsed 3,000 deaths in a single day. So if we had a national strategy that involved testing, contact tracing, isolation, et cetera, on a national level, because viruses do not respect borders. They don't respect city borders, state borders, county borders. We needed a nationally coordinated response. And I personally believe that tens of thousands of lives could have been saved if we had that. So one of the things that we spent a lot of time thinking about with this problem is the fact that people with pre-existing conditions or comorbid conditions are much more likely to get really sick and to die from COVID-19. As a matter of fact, we knew this early on from China. China is a racially homogeneous nation, but even in China, if you smoked, were obese, had hypertension, asthma, any of those conditions, heart disease, you're much more likely to die. Unfortunately, those kinds of conditions are much more likely in minority communities in the United States. All of these things, asthma, obesity, cancer, diabetes, high blood pressure. And that is why people of color around the country have been besieged by and much more burdened by disease and death in the United States. And as a matter of fact, these are data from July, but the picture has not really changed. As you can see, if you're a Black or African American, you were at least twice as likely to die from COVID-19. And if you drill down to certain states in the country, where you look at New Orleans, Detroit, and Chicago, as you can see, at one point in Louisiana, African Americans were 5 times more likely to die than whites were. Similarly, in Michigan, 10 times more likely, almost 10 times more likely. So clearly, people of color have been really, really disproportionately impacted by this virus compared to the majority population. And the reason is because of the health inequities and health disparities that exist in our country. So the way that we're going to get past the problem that we have, the pandemic, is through vaccines. And let me just speak a moment about herd immunity. Herd immunity is probably a concept you've heard about. It comes from agriculture from many decades ago when they noticed that agricultural animals, when they got infected by a virus, at some point, the infections and death would stop. And they noticed that the animals that remained alive had been infected and survived. And that concept of herd immunity emerged from that. And we know that depending on the virus in question, when 60 to 70% of people at least are immune to the virus can no longer spread rapidly through the population. We believe that for SARS-CoV-2, the number needs to be a bit higher than that. Perhaps 80% of people need to be immune to it to slow it down because of its transmission rate. But the bottom line is that we need vaccines to achieve herd immunity. But that means that vaccines must be demonstrated.
Time out. And I said this arguing with Alcorns before, and it made him change his stance that we will not achieve herd immunity without a vaccine. Y'all know y'all heard me say this before on other network shows and all that. I said this, but let him go.
Demonstrated to work in all the vulnerable populations, older individuals, people with underlying conditions, people of color, all of those vulnerable populations need to be demonstrated to benefit from the vaccine. The other thing is that the vaccine trials themselves must include those persons to be absolutely sure that the vaccines will work. The human genome across all 7.5 billion of us are virtually identical, but there are subtle differences in our immune response genes that cause us to respond differently to different things. A great example of that is allergies. Allergies are a manifestation of immune responses. Consider the fact that African Americans are much more likely to have peanut allergies, for example, than whites are, and conversely, whites are much more likely to have allergies to animal dander than blacks are. And because we know that immune responses can be different, that is why we must demonstrate that the vaccine works in all those different populations, because you know immune responses are different. So how do the vaccines work? Well, if you think about how viruses infect cells, in the case of SARS-CoV-2, there's a protein called the spike protein or the attachment protein. It binds to a receptor on the surface of a cell, which is another protein. In this case, is the angiotensin converting enzyme number 2 or ACE2. After the spike protein binds to that protein, it changes its shape and the virus fuses to the cell. There's attachment and then there's fusion. Both of those are mediated by the spike protein. What the vaccines are designed to do is to generate antibodies, as you see there. The antibodies bind to the spike protein and they make a physical barrier between the spike protein and the receptor, and the infection is blocked. In other words, infection cannot occur because the attachment protein has been coated with antibodies that block its binding to the cell. So the vaccines that we are developing, that are being developed, are designed to create antibodies that will bind to the spike protein and keep the virus from infecting cells. So there are 3 types of vaccines that are being developed through Operation Warp Speed that I just want to share with you. So we call them platforms. There are 3 different platforms. So we're going to achieve the goal of these antibodies 3 different ways. At the top is a very traditional way of doing this. We take the spike protein itself from the virus. We mix that with an adjuvant to enhance its immunogenicity or the immune response to it. We inject that directly into a person. So the immune system sees that protein, it's a foreign protein, and we get a response. That's the first platform. The second platform is also one that has been well studied, and it's actually kind of a clever platform as well. We take a common cold virus called an adenovirus. We cripple that virus so that it can go into cells but not replicate. So it's becoming a vehicle for delivery. But instead of the protein for the spike protein, we're putting the gene for the spike protein inside the common cold virus. So the common cold virus is going to deliver the gene for the spike protein into the cells. The cells then make that protein and an immune response occurs. So we're using a common cold virus, we're modifying it genetically, so it's going to make the spike protein. The third platform, which is the one that Pfizer and Moderna have used, that have now been given EUAs, is to use messenger RNA. So I want you to think of it.
Let me stop real quick because I don't want to get too far ahead. Now, remember 2 episodes ago, or it might have been the last Science with Shawn episode we did, I took you to a website where you could see for yourself the vaccines. Remember, we talked about the protein base, right? We talked about protein base. We talked about the viral vector, adenovirus, right? Vaccine, right? And now he's talking about mRNA. So the protein base, he said these 3 are engaged in the Operation Warp Speed. Now, all the other ones outside of that are really not involved in the Operation Warp Speed. But this protein base is unique in its own right, too. But let him go ahead and get into it. He teaching.
This way, the blueprint for all of our proteins are stored in our genes, and they're locked up safely inside of the nuclei of our cells. So those are the permanent blueprints for the proteins. The working blueprints for our proteins are called messenger RNAs. They're made from the master blueprint. They go into the cytoplasm of the cell, and then those proteins are made from that working blueprint. So what Moderna and Pfizer have done is they've taken messenger RNA, the blueprint for the spike protein. They're putting that into a lipid shell. They're injecting that into our body. The messenger RNA is taken up by muscle cells. And as a blueprint for that protein, the muscle cells will then make the spike protein because they have the blueprint now to make that protein. So all three of these platforms have the same result. The spike protein is delivered into our bodies so that the immune system can respond to it in three very different ways. One way we're using the actual protein. The second way is we're using a master blueprint for the protein or the DNA. The third one, we're using a working blueprint or the messenger RNA for the protein. But all three of them have exactly the same result. Spike protein is made, immune response is made. So here just gives you a quick timeline of what has happened with these 6 companies. So 6 trials were to be initiated over a 5-month period. As you know, Moderna and Pfizer started first, so they're the first over the finish line. AstraZeneca started in August, Johnson & Johnson in September, and now Novavax and Sanofi are going to be doing their trials starting later this month or early next year. So Moderna and Pfizer are mRNA, AstraZeneca and Johnson & Johnson are modified common cold viruses, and Novavax and Sanofi are recombinant proteins. So those are the 3 platforms I described. So here's the way the study is designed. 30 to 40,000 people are enrolled in the study. Half of them get the placebo, half of them get the vaccine candidate. We then follow them for a period of time. And in the case of these 2 vaccines, there are 2 injections, either 21 days apart for Pfizer or 28 days apart for Moderna. Those participants are then followed to see who develops COVID-19. And what you're looking to see is whether or not the vaccine group gets many fewer infections or disease than the ones who got the placebo. That way we know that the vaccine is working. So let me just share with you what is in these vaccines, because I've heard people ask me about, heavy metals and other things. Here's what's in these vaccines. This is the total list of what's being injected into your body. There's the modified mRNA itself. There's a mixture of lipids, including cholesterol. There's some inorganic buffer salts, sucrose, and water. That is what is in that vial that's being injected into your body. There are no preservatives. There are no heavy metals. There are no cellular products. There are no animal products. And one of the advantages of mRNA, it can be totally produced without any of these things. It is a chemical synthesis, which makes the quality control and all of that much easier than when you're trying to use biological products. So again, no preservatives, no heavy metals, no animal products, no cellular products. That is the sum total of everything that's being injected into your body. Here's just a quick outline of what the study looks like. This is just a Moderna trial, but the Pfizer trial, much like this. I just want to point out that injections are given at day 1 and day 29. And then for 7 days after each injection, there's a journal that the participants keep to record the reactions to the vaccine. So after both injections, they're keeping a log of whatever symptoms they may develop after being injected. And as you can see, the plan is for these individuals to be followed for 2 years or more to make sure we can gather data about safety and how long the protection lasts. So both of these are 2-year studies to get the data we need to be assured of efficacy and safety. Let me just say a word about why you're getting 2 injections. The way the immune system works is the first time you see something in your body that's never been seen before, we make what's called a primary response. And you'll notice that the axis there that measures antibody concentration is a logarithmic scale, 10-fold increase for each of those marks. I want to point out that when you get exposed the first time, over a period of about 3 or 4 weeks, you make a primary response. It's a decent response, but look at what happens the second time you get exposed. We get what is called a secondary response. It can be orders of magnitude greater than the primary response. As much as
I want to stop it real quick. I want to throw some out there. So out of 92 million vaccine, 92 million doses administered between December and March the 8th, VARS, which is a reporting system, has received only 1,637 reports of death which would bring the percentage to 0.0018% among people who received the jab. VAERS has not detected patterns in cause of death that would indicate a safety problem with COVID-19 vaccines. So I wanted to throw that number out there to you, ladies and gentlemen. 0.0018%. And VAERS does not confirm deaths. It's just a reporting system. 1637. And most of the 1637 has incomplete data. Keep building, Dr. Hildreth.
100 to 1,000-fold more antibodies are made the second time around than the first time around. The other thing that's really important about a secondary response is we make lots and lots of what are called memory cells. The memory cells are responsible for the long-lasting immunity because the next time you see something, those memory cells can quickly expand and respond. And that's why you're getting one injection to induce a primary response. The second injection is to induce a secondary response, which gives you maximum protection. And this just shows you in a very dramatic way, profound way, just how well these vaccines are working. What we're doing here is we're getting the cumulative rate of COVID-19 cases measured in days after the time the injections are given. I just want to say that this is one of the best curves you could possibly hope for. The case of the vaccine is almost flat, but as you can see for the placebo, the cases accumulate rapidly over this period of time.
Now, before he goes any further, I want to add the fact that, you know, Pfizer had did some research dealing with Israel, and they made the suggestion that the vaccine was 94% effective in preventing asymptomatic infection, meaning it could significantly reduce virus transmission. Remember, we had people arguing us up and down, talking about, okay, you get the vaccine, but you still can get infected and you still can transmit. This is telling us that it reduces transmission, right? So I'm gonna drop this I'm gonna drop it in the chat. I'm gonna drop it in the chat for y'all. But this was an Israel study. You know, Israel's far ahead of the rest of the world as far as vaccinating their people. But I'm gonna give y'all that. Let this sink in on your brain right there. Now, look at this chart. The mRNA versus the placebo group. He's basically breaking down the data revolved around the trials. He's showing that there was a spike in the placebo group and there was less of a spike in the vaccine group.
And this is probably the most dramatic demonstration possible of just how effective these vaccines are. And this is just a summary of the two mRNA vaccines. Both of them are mRNA blueprints for the spike protein. Both of them involve 2 doses, 21 days and 28 days apart. The viral efficacy, which is VE, is 95% for about both of them. Now, as you can see, one of the things that's really, really important, both of these vaccines prevented severe cases of COVID-19. And that's a really, really important part of the excitement about these vaccines, is they limited severe disease, which means that they're going to save lives. So both of these vaccines have been reviewed by the FDA committee, and I sit on that committee where we spend a whole day going over the data, asking questions of both the sponsor, the company, and FDA, getting those questions answered. And in both cases, the committee decided that the benefits of the vaccines greatly outweighed the risk and recommended that the FDA recommend issue an EUA. There is a committee that at the CDC called the Advisory Committee on Immunization Practices. They're responsible for making recommendations about how vaccines are used. They have recommended that the CDC prioritize healthcare workers and those who live in assisted living settings or congregate settings as the first priority for getting the vaccine. The next priority would be those who have chronic conditions, who are much more likely to get really sick. Severe disease would be next, and then the general population. There is an expectation that as early as March of next year, that the vaccines will be widely available. And you probably have heard the news stories today that Moderna and Pfizer have agreed to produce another 100 million doses of their vaccines. The original deal with those companies required them to make 100 million doses available, but each of those two companies have now agreed to make another 100 million doses available. So we think that by March of next year, there's going to be tens of millions of vials of the vaccines available, so most of the people in the population can get vaccinated. So let me just say one last thing about why the vaccines were able to be developed so fast, because that's another question I get very often. It is true that 11 months to produce a vaccine is astonishingly fast. I will give you that. But there are some good reasons why we're able to do this so quickly. Number one, technology. The scientific advances and technology that have been brought to bear on COVID-19 are really amazing and incredible. Let me give you one example. The genome sequence for SARS-CoV-2 was published in early January, mid to early January. At least three companies had identified a vaccine candidate in about 30 days or so. So what used to take 1 or 2 years was accomplished in the span of a month because of the technology available to do so. The other thing that you should know is that none of the steps required to evaluate the vaccine, none of the phases, none of the processes have been omitted, but they've been run in parallel. So by having parallel processes versus sequential processes, we're able to shrink the timeline. And the last thing, which I think is very important, for the last 3 decades, an HIV vaccine has been the subject of intense research. And over that time period, a tremendous infrastructure has been developed to produce an HIV vaccine. So what actually happened was the HIV vaccine trials network became the COVID-19 vaccine trials network. So that pre-existing infrastructure leveraged our ability to move quickly. And these are 3 reasons, there are others, but these are 3 main reasons why the development could happen so fast versus other vaccines. So there are still challenges. One of the challenges, how do you manufacture, distribute equitably such large doses of the vaccine? As you know, these 2 vaccines have to be stored really cold, especially the Pfizer vaccine has to be stored at minus 94 degrees. That's a challenge. There's also a logistical challenge of getting 330 million people vaccinated with the vaccines. There's also an issue, what do you do ethically to make sure that people who really need it, in the order they need it, will get the vaccine. And then finally, one thing that's really, really important that we're trying to deal with is African Americans especially are skeptical, hesitant, mistrusting of what has happened, and they have every right to be. So we're owning the fact that if you're an African American, you, based on Tuskegee, Henrietta Lacks, in fact, atrocities have been visited upon Black bodies in the United States since 1619 in the service of research and medicine. So we have every right to be mistrusting. But the science is solid, the science is just unparalleled. But you should also know that people who look like us have been involved in the process and sitting on all sides of the table. I can't not mention that a brilliant young Black woman named Dr. Corbett, who works at the Vaccine Research Center at NIH, was a principal figure in making all of this possible. Many of you may not know that. If you don't know her, Google Corbett COVID-19, you'll get lots of hits. I'm an African American. I sit on the FDA committee that reviews the vaccines for approval. We have people, African Americans, sitting on the ACIP at CDC, making decisions about vaccine distribution. African Americans sat on the Data Safety Monitoring Board that on a regular basis monitored the trials to make sure that they were happening as they should be. So this is not Tuskegee. And the other thing to know about Tuskegee is that because of Tuskegee, human research changed forever. Informed consent became mandatory. Data safety monitoring boards became mandatory. So Tuskegee was horrible. There's no doubt about it. But because it happened, human research changed significantly for all time. So I think we can safely assume and accept that this is not Tuskegee. This is far from being Tuskegee. So let me close by saying the vaccines are on their way. They work really well. but we still got to do things to protect ourselves and our communities because it's going to be a while before we achieve herd immunity. So I'm pleading with you to maintain the mask wearing, the physical distancing, avoiding crowds. It's really important to avoid crowds right now because the level of virus in our community is really, really high. And the last thing we want to do is to be in a crowd. With or without a mask, I would not be in a crowd right now. And so the other thing is we have another virus circulating now. Influenza is circulating. So I encourage all of you, especially older individuals, to please get a flu shot so we don't have two illnesses we're trying to deal with at the same time. And with that, I thank you for your attention. I'd be happy to answer questions.
Now we're moving into the Q&A. First, let me say, Dr. Hildreth, thank you for such a great presentation. I have absolutely no desire to understand medical terms, but I really, truly understood that presentation.
Thank you.
We have so many people watching, so many people asking questions, and thank you all for those who shared this, and we want to continue to invite you to write your comments and questions so we can engage you tonight. Dr. Hildreth, you already answered the first question around racial trauma. And it's a reality. And I really appreciate the way in which you answered it with compassion and dignity, because oftentimes it is dismissed, and it's really a reality, particularly in the medical field, the racial trauma. And that's one of the work we do here at Scarrett Bennett Center. So I want to ask another first question, since you've also already answered the question around racial trauma. Talk to us a little bit about while the vaccine is an individual decision, but it has a communal impact. This disease, right, while it's individually infecting folks, but it really has a communal. So this pandemic this year, it is communal. So I want you to talk a little bit to us about why we need to be mindful about the individual decisions we make, how it impacts the community.
So people need to understand that in order for us to put the pandemic behind us, we have to achieve a certain level of population immunity to it. So in a way, when you get the vaccine, you're not doing something just for yourself. You're doing something for your larger community. And I view it as an act of self-love and community love for our people, love for our communities by doing this. But I know that the trauma, the reaction to all those things that we've been through is deep-seated and real. So we have to acknowledge that up front if we're going to deal with it. And I've tried my best to make sure people understand that I, being in the medical profession and a medical scientist, deeply appreciate the fact that so many people who look like me have that hesitation. But they really need to understand that things could not be more different now. The fact that we have so many people of color, not just on the scientific side, but the policy-making side, the review side. So I'm really, really pleased by that. And I think that going forward, nothing less will be acceptable, right? So there's been a sea change in this, and I think that's one of the consequences of the pandemic, is to make sure that going forward, nothing less than what has happened here will be acceptable.
That's right. Awesome. So we've had some pre-questions, people who wrote in their questions early on this week, and we have questions from the comments. Let me start with questions that we received from the Ask Meharry email. First question comes in, is asking, it is my understanding that a person who has received a COVID-19 vaccine may still get the virus, but symptoms are likely to be milder. Please confirm.
Yes. So the vaccines were designed to identify people who became infected and get disease, right? We can't actually say that the vaccines offer sterilizing immunity. That's a term we use in virology to mean that if the vaccine prevents infection completely, that would be a sterilizing immunity or sterilizing vaccine. That normally requires you to have high levels of an antibody called IgA or IgA in your nose and respiratory tract. We can't say definitively that these vaccines have done that, but there are some studies underway at both Moderna and Pfizer to answer that question. And the way you answer that question is you take the vaccine recipients and you do serological analysis, but not for the spike protein, because the spike protein should be present in all of those who got the vaccine. But you look for an antibody to a different protein, for example, a nucleocapsid protein. If someone has an antibody to a nucleocapsid protein, that means they've been exposed to the virus and infected by it, even though they've gotten infected. Even though they've gotten the vaccine. So we suspect that we're not achieving sterilizing immunity, but the data is very clear that it's preventing disease. And preventing disease will save lives. And at the end of the day, that's the most important thing.
So all those who are receiving the vaccine now, they should still be wearing masks. They should still be taking precaution.
I think that until we are comfortable that we're almost at the point of herd immunity, I think the best advice would be to continue wearing the mask. We know that in both of these vaccines, about 7 days after the second dose, that's when the full protection seems to occur. But we know that between the first injection and the second injection, there's not full protection. So certainly between the first injection and the second injection, or 7 to 14 days after the second injection, people should definitely continue to wear that mask.
And for those who receive the vaccine, can they still be infected?
We can't say that they won't be infected, and the data won't allow us to say that. What we can say is that there's a 95% chance you're going to be protected from disease, which is what these vaccines were designed to do. So the trials are set up to answer specific questions. And preventing infection was not a specific question being asked in this trial. It was really designed to determine whether or not the vaccine could prevent disease. But there's evidence from the Moderna trial that, in fact, it did prevent asymptomatic infections, at least with some efficacy. But we got to do definitive.
Now, this was done in December. We're in March, and we just had Pfizer come out and talk about asymptomatic, protection against asymptomatic response, right? So I just put that article in the chat for you, but this was 3 months ago, and he was telling you that there's some information regarding Moderna, but now Pfizer has did this. So people ask me all the time, they're like, why Moderna, why Moderna, why Moderna, right? For me, it was Moderna, not only because of the data, because Pfizer's actually higher, but Moderna did this extra step. And this, I'm telling you this right now, this extra step. Now, mind you, Pfizer has that same data now, but that data wasn't as prevalent then. Another thing, Dr. Corbett was involved in it. And because it was Black History, we just got through Black History Month. Nah, just playing, but she had something to do with it too. And I just felt more comfortable with understanding Moderna. Nothing against Pfizer, I would take it, but I want that Moderna. Now, good luck to every one of you who have had, who've already had your vaccine and it says Pfizer. Okay? Good luck. He said, I'm trying to find any Pfizer 94 against asymptomatic infection. That's a fact, but Moderna already had that business, sir. I'm leaning toward, yeah, I knew Rasta Man was about to come in here. Rasta just don't want to get a second vaccine. But little does he know that Johnson & Johnson's has a 2-shot vaccine. And if the efficacy rate get up there next to Pfizer and Moderna, you're going to be getting that 2-shot Johnson & Johnson viral vector. How about that? Malcolm said he giving out Pfizer tomorrow. But I'm receiving that Moderna tomorrow morning. But let me continue to let him build. I think this goes on for the duration of the show, but I don't. The rest of this is pretty much Q&A, and a lot of these questions have already been answered, and some things that we've already dealt with per se. So let's see here. I'm trying to see if Dr. Hill did. There's another one, like more recent. But I wanted to lay that one on y'all, man, because for one, I wanted y'all to see yourselves, see your brother getting busy with his presentation and all of that. I wonder after the 80 to 90% of the American population get the vaccine, will the scientific and public health system address Black people health challenge? Richard, they have been addressing Black people's health challenges for quite some time. That never stops. Addressing health challenges, no matter what color we are, never stops. You know, they always, your doctor, your personal doctor is always telling you to exercise, eat right. You know what I mean? Lay off this, lay off that. This is coming directly from your doctor. And that's never going to change. So we got to be a little bit more like, Richard, we got to be a little bit more specific about really what you're trying to get at in the actual perspective of the actual question. But I'll take a Johnson & Johnson too. Oh, he got that one shot kill. Okay. See your cousin. Okay. Yeah, by the way, I'll catch you soon, Chavis. 2 weeks or something like that, bro. Let's see here. What's some new claims y'all been hearing in the community regarding the COVID vaccine? If you pay close attention and you realize that a lot of the claims that was going on before has actually dwindled. You know what I mean? So now it's pretty much like the claims have dwindled and the vaccine participants has increased. Have y'all not realized that? And here's the thing, we do need to get a lot more people vaccinated a lot faster so that new variants can't form and people don't have to go back and get an extra shot. But y'all ain't got no new claims. So Benita, it's time that you get over your little hump. It's time that you knuckle up. You done already been infected. You done already went through hell weeks. You don't want to get reinfected. You might as well step up and deal with it. And go on down there and get that vaccine. Go on and get that vaccine. It's the best thing you could do to yourself. You make all the faces you want to make. Soul food has been heavily discussed. Yeah, man, it has. You know, we eating foods that's high in salt. You know what I'm saying? We eating burgers every day. You eating meat 3 times a day, bro. It take like meat to digest. It takes 6 months for meat to digest. So imagine you eating, beef. If you eating all that over and over, like that's crazy. That's crazy. You eat a hamburger for lunch and then a steak for dinner. Ad Cha says, Shawn, was the government responsible for the development of mRNA or was it private companies? Was it both together in the development? Where does Miss Corbett fit in? Miss Corbett Miss Corbett fits in because she's in the NIH. So she's a part of the NIH, the National Institute of Health. So she comes in because of her involvement in the research over time. They've already been doing this particular work. And so she was a key component in working that out for the Moderna. Now, at the same time, she's working on the Moderna. Pfizer which is, you know, which is here as well. They were working on the vaccine as well. So they partnered with BioNTech, which is in Germany or something like that. So they, you know, that's how they come about to get their mRNA information out as well. So you had both that were really significant. As far as government, the government really ain't got no say over it. The government is just, you know, listening to the scientists. The scientists are what led to this. Technology and scientists are what led to the development of the mRNA. The government just approved, you know, funding or whatever is required for it. Now, initially, we would have had it. If Trump would have got reelected, we wouldn't be where we are today as fast as where we are. You got to think. And yeah, I heard she was cutting up on Twitter. I seen Chill page. Chill says she's been going in because of the success of the Moderna vaccine. I would be cutting up too. But we wouldn't be where we are today because the last person was an idiot. He was anti-science, and it actually hindered us. Like Fauci was muzzled. We couldn't get the information that we needed out, and it caused problems. Like we could have prevented a lot more deaths. How many deaths? I can't say. Remember, on the pseudo killers, Unc was trying to defend Trump. Remember, he was like, well, we're in the middle of a pandemic. Ain't nobody ever been through this before. You know, who could have did better? You feel what I'm saying? Like he was saying that, like, you know, he's trying to justify it. And I was like, that's not the problem. The problem was his ignorance in the moments. And it took a while for him to catch on to what I was saying. And then he finally caught on and just say, all right, Trump a total idiot. Is the NIH a part of the government? Did she work for both simultaneously? She works for the NIH at CHOC. Jay God, I see you, bro. Yeah, I see you posting on in the Dagger Squad too. Some of that stuff you posted, I already had some info on, but I ain't know if you grabbed it yet. But Adcha, what you think the NIH is? Is something wrong with the NIH? What's wrong with the government? Help me understand what you're really trying to say. Just look it up. Just look up NIH. National Institute of Health. Just Google it. It's the Department of Health and Human Services. They got 20,000 plus people in there. Excuse me. They get grants and funding for their research. Fauci is the lead guy over there. They hella active. You know what I mean? So what you want to say about it? I'm trying to understand so I can know how to actually answer your question. So what's the difference between, okay, so let me go ahead and do this. So I'm trying to determine if the government is not taking enough credit and giving it all to the private sector. To be honest, man, it don't even matter. You don't see people boasting about it. They just letting the scientists are getting all the credit. The private sector ain't getting anything. The government ain't getting anything. It's the scientists. Like I see you, LB, second shot next Friday. The scientists have been getting way more praise than anything. Yep, they saying Novavax is 96%, bro, but I don't know. I don't know, Rasta. We gotta see that. We just waiting on the data for that, Rasta. When we can get the Novavax, hold on, let me see if I could pull up something from the back. Novavax vaccine trial. Let me see if I can get it. Because that was published 3 hours ago. Well, earlier today they published that 96% stuff. So I'm trying to actually find out if I can grab the primary. Let me see if I can get the actual source up, and then I can put it on the screen. If I can get that. If I can get that up, we be rocking. I know their stock is up. I know the stock is up. That was good news for them, but I want to see if I can pull a study that we can vet. Because right now all you got is like news companies saying certain stuff about it. We don't have any available data that we can go by that we can actually deal with. Because the last press release that we actually get regarding Novavax is the press release from January 28th. And they were talking about their results, which was at that time it was 89%. And I can put that on the screen because this is directly from the source. But I mean, do we know what a Novavax is, ladies and gentlemen? All right. It's a biotechnical company developing next generation vaccines for serious infectious disease. Today announced that the NVX COVID 2373. Y'all seen me talk about that. Look. Where I'm at. Oh, here you go. Here you go, right here. NVX, which is Novavax COVID 2373. I think you might have missed the earlier roster, but this one we talked about earlier. But as far as the efficacy and all of that, we didn't get into the efficacy of that. We talked about the actual trial. But this is phase 1, phase 2 trials for recombinant spike protein nanoparticle vaccine. We haven't got into actual, you know what I mean? So here go your trial, and then here's your trial number, clinical trial number doc right there. But we talked about it right here. But as far as they're saying here the vaccine efficacy of 89.3% in its phase 3 clinical trial conducted in the UK. So we'll know more about the NVX code 2373 soon, and we can just be more specific because we need all that data. See, they're saying 83, but that was in January. So they said approximately 90% of COVID-19 cases attributed to okay. So we just gotta be aware of that. Cheers, Musif. Yeah, I see you, Cheers, Move. What's good? So what kind of vaccine is Novavax? Anybody know? We told y'all. Even the doctor just told you. Dr. Hildred. Y'all got to know what it is. You can look it up yourself. I don't care if you look it up, but you got to know what the vaccine is and what it is not. Know what it is and what it's not. Look, you get 2 injections. If you are selected to participate, you will get 2 injections of the look at that. There you go. 23 days apart. Know what the Novavax vaccine is. Boom, boom, boom. The trial has completed recruitment on this platform and there is no longer accepting new referrals. Boom, boom, boom. All right, let me go back and check. So, Draper Finance Private Scientific Research. Okay, Richard, what's the point? I believe that if people understand the things that the government does to improve the lives, it would kill some of the government is bad at. Oh, Ed Char. Okay, now I understand what you're getting at. We'll never really get rid of that because people have biases and they're driven by emotionalism. and therefore it causes people to not really, you know, to really give credit where credit is due in some things. But you know, watch Science with Shawn. Should black people take the vaccine? Oh yeah, oh yeah, yep. 78-year-old aunt gives her accounting experience with taking the vaccine. Hey, matter of fact, Juju, I think that show was a few weeks ago. When is she scheduled to take the second vaccine? Is it coming up? Dave B, did you ever talk about the side effect of the swelling of the armpit that happened to me after the first shot? Yeah, that has to deal with Dave. Yeah, that's common. The lymph node or whatever it's called. Some people seen it under the armpit. That's common in the vaccines. Some people thought they had cancer developing or something like that, but that was just common in a lot of people that actually received the vaccine. So you can expect that. That's one of them that was later reported. Also said it's less effective against the UK and South African variant. Yep. There. Put it like this: the South African variant is like scary, but if it's 60 or 70% effective, you'll take that. It's just not 94% like all the other stuff. Yeah, your auntie said that this generation of people are just weak. Yep, lymphatic inflammation. Yep. Nah, yeah, it happens. They got studies and stuff like that. They talked about it on TV and the news. CNN talked about it, but it's common. Right. Yeah, your doctor will send you a mammogram because they'll think it's a cancer. Yep, and it's not. It's just the lymph node swelling. Let me see if I could pull up something regarding the lymph node swelling. Now, I really didn't discover it, but I knew that it was happening. Boom, boom, boom. Yeah, so Medscape published an article regarding it, and Malcolm not on the panel to actually get me into Medscape because he has to sign in. Malcolm, you still in the chat? If Malcolm's still in the chat, we can get him to get it assigned into his Medscape account and get us that backdoor information. See, that's what y'all don't know. See, we got science on our side. When we can't get an article and it's in certain places, oh yeah, we gonna get that article. So this from the Alabama site regarding the Moderna. You know, before you get the vaccine, these are all the things we already know. After you get the vaccine, they bring up, look, lymph nodes in the same arm of the injection, swelling, hardness, and redness. They really pretty much updated that information because they really didn't think anything about it until it started being reported. Yep. So we good. What up, unbiased? But yeah, we don't need it now, man. But hold up real quick, y'all. 1 second, Mondo. One second here. Let's see. Y'all reading what I got on the screen? Let me zoom in. Let's see if that's a little bit better for y'all. Right there. Think that should help. Yep. There y'all go. Oh yeah, y'all can see that good if you got an iPad. I don't know, some of y'all on them smartphones, I don't think y'all can see it because it looks blurry than a mug on a cell phone. Let me turn the chat off. Let me turn it sideways. Still looks blurry on the cell phone. But if you got an iPad, a laptop or something, you in there, you can read it. Yeah. All right, check the inbox now. Let's see what else we got going on. Facts. We got some people in it. Listen though, but look how many people that have been vaccinated that's in the chat room. You know what I'm saying? At least had one shot. It's a few people in here. You see what I'm saying? So, Benita, wherever you at, you surrounded by people who actually have already had the vaccine. And that's just a fact. Where the questions at, man? Where y'all at with the bull crap? How many people supposed to have died? Who got the pseudo? Well, Unc was supposed to tag me into a pseudo post. So let me just type in Unc Wed's name. Wherever Unc name at, you can always bet he affiliated with some nonsense. So let's see. He put the per research up. Yep. See, this is why I do this. You send Uncle source, and then you watch him post it. Shout out to Chavis for that one. Said, did you get the vaccine? So let me pull up. Let's look at Unc stuff real quick. What's up, my brother?
What's going on, fam?
Man, chilling, bro. What's good with you, man?
Not too much. Sitting and listening to the show.
What you got going? What you got going on, man? Tell us what's going on in the M Town, man.
Ooh, man, I just down there teaching, trying to run this little help keep this teaching program rolling, and also on my off days doing that overtime, man, vaccinating. So tomorrow gonna be an overtime day. Go in and do some Pfizer vaccinations up there at the training center. So
Okay.
yeah, man, it's the Pfizer this time. I was doing the Moderna, and now we're doing the Pfizer. I had my second shot. Second shot knocked me on my ass, man.
That's what I'm hearing. So what I'm gonna do is, and you tell me if I'm right about this. So what I'm gonna do is, I'm gonna go on my off day to get the second shot.
Yes, sir.
Cause I ain't gonna be working, and then I'm just gonna deal with it. I'm gonna deal with it like that.
Just have your Tylenol or ibuprofen on deck. My second shot though wasn't as robust as the first response, but I think that was because I was more prepared with my medications. You know what I'm saying, for the side effects. But it put me down. Woo, boy! It put me down for a good day. I bounced back the second and third day though. Couldn't cartwheel.
So let me ask you this. So after your experience with that, you worked the second day.
So let me see. I got the shot on Saturday. Early Saturday. No, correction. Friday. So Saturday, probably about. I got the shot Friday at about 3:30, 4 o'clock. Saturday about 11:30 noon time. I can feel it. I can feel it coming. So the rest of that day, I was done. I woke up. When I woke up the next morning, though, I was a lot better. You know what I'm saying? I was able to actually get up and eat and all that other stuff. But so I was down about a good 16 hours.
16. Okay. All right.
But too, that was my third exposure to COVID, to a coronavirus protein, to the spike protein. So, you know what I'm saying? I think the doctor just hit on that about what happened when you get those additional exposures. So,
yeah. See, my homeboy was like, I'm listening to my doctor, you know, because he had the virus and it almost took him on out the game. But he was like, he ain't getting the vaccine yet till the doctor said. I said, well, you listen to your doctor all you want to, bro. He He said the antibody's supposed to last like 8 months. I was like, no, antibodies ain't lasting 8 months.
Right.
But instead, you know, it was other people right there, so I didn't want to argue with them or nothing like that. I just said, no, the antibodies ain't lasting 8 months. You're not getting antibodies for 8 months.
Man.
Because if you're getting antibodies for 8 months, why the hell we got people reinfected in less than 3?
Facts.
So I ain't wanna say that because I ain't want to make his doctor, you know, make it look like I'm trying to argue with his doctor, and I ain't no doctor like that.
Right. Yeah.
They ain't gonna then they really ain't gonna listen to you, even though you might be telling them the truth. But I told him I'm not listening to no doctors. I'm listening to the science. What science say? Science tell me get that joker. So yeah, man. So what I want to do is I want to kind of go through. Shout out to Chavis because he sent this early, like 5 or 6 in the morning. You know what I'm saying? He was up doing a little reading on the per research. And black people, we went up, black people. We went up. We went up 19 points from November. So we getting the vaccine. 61% of us that was a part of the research. And it's gonna be higher than that. Cause we finna go get the vaccine tomorrow. But anyway, let's look at the comments real quick and see if we can find something funny. Eric Wilson said, "Did you get the vaccine?" Unc said, "This Saturday coming, bro." Tiffany Hall, his daughter, face upside down, look. And then he said, "Tiffany Hall, get your damn shot. Woman, you making me look bad." And then get vaccinated, misinformed kings and queens. And then, and yes, I'm vaccinated, Alfonso says. Nada by Donnie Links. Nunu, she got her shot. Won't happen. So we already know what this gonna do. It's a read, man. And bro right here said he getting vaccinated. See what I'm talking about? And then here we go. Does the vaccine stop you from getting COVID-19? No. Does the vaccine stop you from transmitting COVID-19 to others? No. Then why take it? So there's 30 replies on this one. So let's see if we can I want to reply to this. Because didn't I put up a source that said something about this just a minute ago? Didn't I put up let me see if I can go pull my source up. I'll get back to it. I don't want to do it live. It's embarrassing. But yeah, we got a source that we really just went over talking about it, right? We just talked about it. Israel, right? We talked about Israel. I brought it up and I put it in the chat. I know I ain't slow. I brought it up and I put it in the chat.
Yep, you talked about the Israel, John. Sure.
Right. So Israel has a trial. Here you go, right here. Y'all see that? That right there. That's the source. That's the source to kill this right here. That's the source. So watch the comments. Let's see if I can do this real time. All right, let's see if I show up. And then we'll read what all the ignorant people saying. And there I go right there. Yeah. Okay, so let's have some fun, ladies and gentlemen. It's all about learning. View one more comment. Man, stop hating. You acting like we asking you to get the vaccine. Tell me I'm lying. I will post directly from the official website that states the same. But if you want to take this experiment, that is your choice. So we already know, ladies and gentlemen, that this is not an experiment, right? We know that. So we can actually address it point for point. But I'm gonna say you whack and you mad, and you made. Well, he's basically saying you made that up and you're lying. Okay, I will post it. Reading comprehension is essential in this thing we call science. So he posts, what is an mRNA vaccine? Let's see what he posts. I don't see the source, but this website is used for cookies. I don't know what he's saying. Limitations of COVID vaccine effectiveness. Vaccine may not protect all vaccine recipients. Adverse, which, come on now. We know why they put this on here, right? Okay, so Malcolm, why would the vaccine not protect all recipients?
Say again.
Why would the vaccine not protect all recipients?
Everybody that got it, why wouldn't it protect them?
Yeah.
Uh,
I'm challenging you right now.
why would a vaccine not protect someone?
Right. So, for instance, somebody gets the vaccine and they don't develop any antibodies. It's very rare, but
Okay.
there's a case out there where someone doesn't develop the antibodies.
I'm gonna say they're immunocompromised.
Thank you. All right, so he don't know about that. So he's going on. Now he says it's not FDA approved either.
Oh, wow.
He doesn't understand that this is in a an EAU phase, emergency authorized use phase, right? Which means that we're in March. So maybe April, May, they can go for FDA approval. Because it's been 6 months. Ain't it after 6 months they can apply for full authorization?
You got me on that.
If I'm correct in that now, I don't mind correction. So I think that it's after 6 months they can apply. Let's see.
You saying 6 months with the EUA, they can apply for the BLA?
Yep.
Man, I was listening to not to get off this. I was listening to NPR News, and they were saying that the people that's most hesitant to get it were white men who were Trump supporters, and aside from them, it was Hispanics under 45, and they mentioned African American, but they did mention that more African Americans were starting to say, "Shit, I'm getting that joint."
Oh yeah. Okay, so I'm trying to find it here. But you got to go through the vaccine approval process. They actually have a biological license application is approved only if FDA determined there is. Here we go. This is off of Ashto. So there's a document that they actually have. I'm gonna try to put it on the screen in a minute, but it says this from November 2020. Is approved only if the FDA determines there's substantial evidence of safety and effectiveness from adequate controlled trials. Okay, so we know right now that the safety is high. So it goes to phase 1, phase 2, phase 3. This is the process: phase 1, phase 2, phase 3. Manufacture while awaiting approval. ACP work group. The EUA application and review. The ACP and the CDC review. Vaccine candidates currently in phase 3 in the United States, and it tells us what are currently going. Important announcements and deadlines. Shoot, man, we should be getting up on it. It ain't giving me a specific, but it's telling me they can. Okay, so FDA recently signaled that a COVID-19 vaccine may be approved through an EAU that utilizes standards much closer to that of a BLA, which we're aware of. FDA guidance released October 6 requires 2 months of follow-up after patient's second vaccination prior to EUA approval. Okay, so phase 3 trials is coming up on what? Their second month for Pfizer and Moderna? They should be ending that. So we should be coming up on that. We should be coming up on that. So hopefully we'll get to that point now. But we know we're in the EAU phase and we don't need full authorization. But you can go to the FDA.gov and they have the BLA request for permission to introduce. But they don't tell me specifically where I can just go without reading all these other documents to give you how long it normally takes. But it's usually after the safety and effectiveness has been shown and proven through the clinical trial study. But right now we're in the middle of a pandemic, so we should be getting that from the FDA. That's a good question to ask someone. Now, he said it's investigational, aka experimental. All right, then it said Isla, he says, stop, can you read, man? He says, no need to add words. And then he puts up, I hate when people use kind of like Healthline. And then he said, and what's your point? And then Alfonso comes in and interjects, says the brother's misinformed. Calls his information trash. And then the brother says the information came straight from Moderna website, and the last article is from the Healthline. Why is it trash? Because it's contrary to what you believe. He says, have you ever had a vaccination? He said, back in the 80s when I first went to public school system. So what is your problem? And this is not a vaccine like those. This is a new technology that doesn't use a dead virus cell. So because this doesn't use a dead virus cell, then I would ask him, if it had a dead virus cell in it, would you get the vaccine? So let's see if he's asked that question. You really don't know what you're talking about. Nope, he ain't gonna be asked that question. Nope, he said, you sound like you can't stick to the subject. So let me post this again, which is redundant. Now he says, now show and prove from a medical journal or something that can be verified and proven. So they're going back and forth for a reason. I don't want to get into all this. He says he's a Muslim by name, whatever. Okay, so somebody commenting behind me, I guess. Nah, nobody did. But I would at that point I would ask dude, what's his dude name? You got to do it like that. That's a great question to ask him. So I answered one of his questions about the transmission data, and Moderna did do studies on the transmission data. And what was his other point of contention that he made up in here? Have you ever had? He brought up headline. I don't know what this was for. And FDA approved. Oh yeah. Safetyness and effectiveness. Dang, I can't spell. All right. So that was on post. I just sent everybody on post. Let's see. I knew somebody was on here. All right, did. I was waiting on it. Yeah, that killed them right there. 94% effective in preventing asymptomatic. It's a wrap. It's a ball game.
Hmm.
That's how you take him out. You take him out. See, on play, look, 30 comments. You know what I'm saying? Some of these ain't on, but 30 comments, you just come in and you do boom. And that's why Unc always say I take the fun out of it. You come hit him with the boom, and then you come back and you hit him with some, you know what I mean? You hit him with the other part. And I think my other comments might have went down there. See, I'd have sent everybody over here. How y'all gonna be in this chat and then on Unc post laughing at the guy? Y'all wrong, man. Y'all wrong. But that's where we at with that. So we just basically answer his questions, and then anybody else questions we actually can answer. But there, really wasn't too many points of contention here. Just some people saying whatever. But it's best to not do this. It's best to, like, if you're against the vaccine, it's just best to say why you're not getting the vaccine and not try to downplay it or try to convince people to not get it because you're not interested in it because you're not paying too much attention to that.
Right.
So until you become more educated on the vaccine science regarding that, then you should just, leave it to people who know, so people can ask these questions. Our whole job is to make sure that we are properly informing everybody, man, and giving them the best opportunity to make that decision.
Absolutely.
Let's see what we got in the chat. Let's go back. I know they cooking in the chat. Good night. What you know about that China vaccine? Kevin Henry, that China vaccine, I need to see the data on that. That China vaccine is I think they got a first generation and a second generation vaccine. Yes, Sinovac is a second generation vaccine. I think that's what it's called, Sinovac. And I really haven't seen any data on that, but we have seen the data on everything else, so we good. We're good on that. So I just ain't taking it. I think the vaccines that we have right now, if we have the advantage of being able to do so, it's cool for us to go ahead and do it. All right, let's see. Let's see here. All the people. All right, now, good question. At least they are asking instead of making it up. Were you hydrated? Are they asking you, Malcolm, was you hydrated? Can I have kids if I take the vaccine? Asking for a friend. You sure can. People getting pregnant in the mug during this thing.
Right. Hydration. I'm decent on hydration.
Good question. He misinformed, so I can see a slight. All right. Some peace and virus. What does he mean by protect? Remember, we still are being infected with other viruses, but you know what I mean? But because of vaccines that we took as children, we can't tell it's not, what is it, transmitting to or turning into a disease for us. Our immune system is just blocking it from you can't never get rid of these viruses, bro. The viruses are gonna always be around. They're gonna outlive us. But we have grown immune to these particular viruses that were once deadly. Yeah. So let's see. A vaccine doesn't protect. It's a system that triggers it. There you go. And then everybody viewing like the show today. All right, appreciate that. Some people in my family are now open to taking it after other members got their first Moderna shot. That's what's up. Uh, maybe we need a show on what's protection and what's prevention. Yep. Yep. I see another book cooking. I don't know, Robert Rand. I'm my brain. I got 2 books left. I got one. I'm supposed to have 1 book left, but I purchased another book, so I have 2 books left to do some further research, and then I need to get. I gotta go back and I did cross referencing, and I gotta go back and review my notes that I made on all these books and start putting some of this stuff together. And possibly if I can. I may try to interview some people to further or strengthen the arguments that I'm having and some I'm getting ready to write against. Once I do that, I might turn the tide and get into some type of. I was supposed to be working on a project about like vaccines with 2 other people that I can't say anything about because that still might happen. Oh, you was okay, Zane. I got you. Asking Dave B. Cool. A book about Great Harlem debate and the unexpected crisis of the pandemic and its effect on the psychology of Black people. That's interesting because, yeah, we were sitting there kicking the vaccine science for a while. The next thing you know, a pandemic did hit. Cedric is late to the party, of course. We 2 hours in and you just showed up, Cedric. So, Mal, on the vaccine trail, man, how has that experience been for you as far as doing what you normally do it on a day-to-day basis? Have anything changed? Have you made some connections, or how that's
Oh man.
been?
Well, since the early start of the pandemic, when we were just doing the testing, I had the opportunity of working with a bunch of doctors, infectious disease officers, infectious disease doctors and officers, because we got one, that work for the department. So I got a chance to ask a lot of them, up close and personal questions, or questions that a lot of people want answers to, questions at the time that a lot of people didn't have the answers to. So I've been in a lot of question and answer sessions with doctors. Pretty much everybody, man. I've been bumping shoulders with quite a few individuals, man. It's been a hell of a ride. But the vaccine thing, it's serious business right now. It's the primary goal in our city here is to get people vaccinated. So they're increasing vaccination sites in almost every area of the city they can, especially in the underserved communities, which tomorrow I'll be in, the community that I actually came up in. And so that's why I was like, oh, hell yeah, let me put my stamp on it, So I do on a regular basis, though, I'm at the teaching institution or teaching program. So again, on my weekends, days off, that's when I get a chance to kind of reach my hand out to the city and maybe go out there and do some frontline work or go out there and do some vaccinations. But it's been on, man. Been hitting these shoulders, man. I feel good knowing I'm helping people protect themselves and their families, protect my family and stuff like that. So, love it.
Okay. He said my source is not credible enough for him. However, that would mean, if true, that Pfizer vaccine is better than Moderna. See, this is what he don't know. We also have the evidence from Moderna. So now I'm gonna go back on the post and I'm gonna post Moderna.
Got him.
Against asymptomatic with transmission out. Yeah, I got him. I got him lined up. Asymptomatic transmission. See, this is what he didn't know. Vox even put an article out on March 3rd. The growing evidence that COVID-19 vaccine can reduce transmission explained. Here's what we know. So what I'm going to do is I'm going to give this to y'all because I know y'all didn't know this. But there's more evidence that just continues to grow. So he don't know that we live. I'm going to put debunked again. So, all right, now I put that in the chat. So it says more than 50 million Americans have now gotten their first shot of COVID-19. 25 have gotten 25 million the second shot. Strong evidence that the two COVID-19 vaccines are getting better. One by Pfizer and the other by Moderna, highly effective at preventing illness, hospitalization, and death. Despite the fact that public health officials and media outlets have been warning that vaccinated people need to behave largely how they did before, that's because we didn't know as much about the vaccine effectiveness at preventing transmission to others. A vaccinated person may be well protected from COVID-19, but if they carry the virus, could they possibly infect other people around them? But a growing body of evidence suggests that the Moderna and BioNTech, or Pfizer and BioNTech vaccines do, in fact, cut down on viral transmission. Two recent studies show some pretty favorable results. One from the UK, another from Israel. Okay. Now, in other words, even as we wait for more definitive studies on the vaccine effects on transmission, more and more scientists think we do have enough information to feel pretty good about the vaccines. Then you go on and you get, you can read that for yourself, but, it's an ongoing thing now. This is why the CDC came out and they said vaccinated people can hang around vaccinated people. What you talking about? The brother says the signs don't match up. He said he willing to build. He's respectful. Who you talking about, Sutek? Send him the link. Oh, you ain't got it. What signs don't add up? I'm confused. Who you talking about? Oh, okay, I got you, Kevin. Yeah, I ain't got nothing against the AstraZeneca. I just don't have all the data. So I really can't. I mean, there's a reason why the FDA is not approving AstraZeneca here, because some of the testing is unfavorable. But Sinovac, which I think is the China one you're referring to, I have read some information on that, and that has been what it is. Okay, you said check the back check. I don't see none. Okay, I see it now. I can't see none of that. Oh, this the let me see if this is the brother. Hold on. Nah, this ain't the same brother. Oh, you having a whole conversation. I mean, I don't know if I'm gonna be able to change the man's mind. I ain't trying to change his mind. He says, ain't no way I'm taking that stuff. The science doesn't make sense for a disease where the survival rate is not. So he don't understand he don't understand the he's saying the survival rate. He's got that all wrong. Yeah, he's got that all wrong, Sutek. I mean, but you can send him the link. I mean, Cedric is on here now. He even took a nap. Maybe he might be able to put up some type of fight.
Of course, I'm willing to put up a fight. Good night, family.
What up? What's good, brother? How you doing?
I'm good. I got my shot today. I'm proud. I got my shot. Yeah.
You good.
And people don't realize I'm immune compromised. I got lupus. So I've been living super careful for the last year. You know what it feels like to get that burden off your shoulders? I feel like I just got out of jail, although I've never been.
Mm-hmm.
So what's the topic? I just heard what you were saying, Shawn, and that's true. What we're now seeing that the vaccine reduces viral load extremely. So there's no expression of the virus once you have the vaccine. Transmission reduction is going up. So it all in line with what a good vaccine would do. Initially, you can't tell people you got your shot, live willy-nilly because of the asymptomatic nature. But what we're seeing now is that the viral load is not reaching to the point that is any of it leaving the body to cause infection in the other. So I thought that was going to be the outcome, because that's how you achieve herd immunity and ultimately get rid of the virus. But the information is coming out like that now. So yes, and as expected, it will reduce transmission and increase the herd immunity over the long run. So we're on the right track.
Right. And this, I mean, think about the behavior of the CDC in the last week. The CDC has came out and made some adjustments. They're saying these people can do this, these people can do that. However, you still, you know, among unvaccinated, you want to still social distance. You want to wear your mask. You want to continue to wash your hands. You want to continue all these measures because these people aren't exposed.
Yeah. Until we reach that magic 70%, everyone still needs to take the same precautions. I got my shot today. Doesn't mean I'm mask free. It only means the risk of me catching COVID has been reduced by 98%. I got the Pfizer vaccine. Its effectiveness is 98%. So I'm in a better position than I was yesterday. Doesn't mean that I drop all precaution, and hand hygiene has to be something that becomes common practice. I teach food safety, and hand hygiene is the #1 reason we get bacterial transmission. So that is now part of people's lives, and it's a good thing.
Yeah, keep building for me for a second. I need to grab me something to drink real quick.
Okay.
But Malcolm is on here too, man. He might got some good questions, or you might have some questions for him since both of y'all fighting this front line.
So how's Malcolm? I want to know, how is the Black response in your community? My community is predominantly Black, and what we're seeing is the difference in education level is playing a great role.
Oh yeah, I definitely agree with that. I'm seeing the more older group of people though seem to be more on board with getting it, but the younger group, probably they're under 50, are a bit more reluctant. But I work around a lot of other frontline workers, so they are on board with getting it, even though at one point they were hesitant about it. The majority of them have kind of gave in, but it's definitely an education difference. And I was talking to one of my coworkers about that the other day. I was like, what I noticed is the people who are reluctant about it, they don't have any idea, or maybe have forgotten about the science of immunity. Whereas the people who were with the vaccine and were like, I'm getting it, there was they had some understanding and level of understanding the immune system and things of that nature. So
my mom was reluctant for a little bit, but it took a half a minute conversation with me, and that was okay. She got hers today too. It was like, you're not taking it, mom. We're all vaccinated. You know that, right? This vaccine is safer. Okay, that was it. She has 5 kids. We're all vaccinated. So it was pretty much a common sense conversation with my mom. The younger generation, they have all these feelings and opinions, but without facts.
True.
And they're arguing with me who can break the science down. I'm like, no, what you're saying doesn't make any sense. It's like this and this. And they just keep moving the goalposts, moving the goalposts, moving the goalposts. So I don't know where the reluctance comes from in this generation. When you look back at the other pandemics, people were lining up around the corner to get their vaccines. But I guess it took a little bit longer to produce those vaccines, and they saw people die. Like, they saw a lot of people up close die.
Right.
I guess that's the big difference. In my community, we lost 27 people on a small island. And honestly, our policies are zero. I worked in public health for 14 years. So I wrote a suppression plan and I gave it to government, but egos play a role. They didn't implement it. I used Taiwan-based system, Taiwan model, keep the community open. We end up going into lockdowns and shutdowns. A year ago, everyone was begging for a solution. We're a year later and we have a solution, and there's reluctance and pushback without any understanding of the science. It's sad.
Where are you located?
Where I work at? I live in St. Martin, the Dutch Caribbean.
Oh.
So, small little island, always sunny. But yeah, this is a pandemic, so all over the world, we're in the same boat. All over the world, we're in the same boat.
Correct. I want to say a year ago from today, didn't they declare it a pandemic? Was it a year ago from today or yesterday?
No. From the time the pandemic started. It started in February. We're an international hub. So we have 110 nations that live on the island. We have the regatta, we have the carnival. So we had 2 international festivals around February against well, it's an economic interest, but people like me who are in public health going, no, that's not a good idea. Don't do it. So we got the first wave. Our numbers were up in the hundreds of people infected. The hospital didn't get overrun, and we had a total of 28 deaths in the meantime from the COVID. We're lucky. It should have been and could have been much more, but we're lucky the numbers are down. We're now we're in a population of roughly 70,000. We have 16 positive cases at the moment, but again, the testing is a la Trump, so you can't be too sure about those numbers either.
Right. I'm a little bit nervous though. I'm wondering, will there be a big breakout? Another big boom, because spring break coming up and everybody.
Mm-hmm.
So I'm a little nervous.
I was one of the activists that got our carnival canceled this year, and already the carnival proponents it's only 16 people. Why did you guys shut carnival down? We needed our carnival. I want carnival. They seeing the numbers going down and assuming that everything is in the clear. We could have had carnival. Now, if you know what a Caribbean carnival looked like, man, that's COVID fever right there. We up close and personal. The intimacy level increases tenfold. It's just what we do. The carnival at this point in time is just a dangerous thing.
All right, so let's deal with can y'all hear me?
Yeah, Shawn.
Yeah.
Okay, so let's deal with Michael. I don't think he's gonna come in the chat. He says those other shots didn't involve. All right, so let's see. Here you go. He came in the chat and he says, I'm here, I'm over 50 and still not on board. So Zane asked him if he had another vaccine. He told him yes. He says those other shots didn't involve mRNA manipulation. So let's deal with that. What is mRNA manipulation? Because that's not what this vaccine is. It's not about manipulating anything.
Nope. There is no manipulation.
Right. It's mRNA is a third generation vaccine. Doesn't contain, it's safer and it's easier to make. And it doesn't contain a weakened or dead strand of the virus. It uses nanolipid particles to get the messenger to where it needs to go, to tell your body, hey, look, this is how you defend yourself against this new virus. This is this big old fat spike that is going to try to attach itself to your cells. You need to redevelop this. And you're going to use your communicative system, which is your immune system, or let me just go a little step further, ribosomes to teach one to train one another, using that protein to train one another to build its block up to knock you out.
Yeah. What happens is, and this is the breakthrough with the third generation. Johnson & Johnson is using the old technique whereby they're using an adenovirus to get the DNA of the spike protein into the nucleus of the cell. It's unwrapped. The mRNA is produced, pushed out into the cytoplasm of the cell, and in the cytoplasm is where all the proteins via mRNA are produced. Whatever protein the cell needs is produced in the cytoplasm via mRNA. With this new vaccine, third generation, the lipid shell is the great breakthrough. Now we don't need to go into the nucleus. So there is zero risk of anything happening to the nucleus. There is no way that you can get any fusion, any change, any difference in our DNA. Yeah.
All right, hold on. So let's deal with it like this. So he says, it doesn't matter to me. Okay, cool. Then if it doesn't matter to you, then what is your contention? You should just say you're just not interested in the vaccine and not argue back and forth.
There you go.
He says, I said, he says, you have no real contention. And then he says, I actually do have contention. Okay, so what's your contention? He says, I'm a science buff. I'm going to refrain based on science alone. You're not a science buff, because if you was a science buff, you would understand that scientifically, the data has shown that these vaccines are 94 and 95% infectious. They are preventing disease and death. And they just threw out new data talking about transmission. So science buff, you're not aware of what the mRNA vaccine is. Now, then he says, it's safer by whose standards? It is safer by the standards of not only the FDA, but other governmental agencies around the world.
And it is safer just based on the technology. It's like driving a car without a seatbelt and driving a car with a seatbelt. I don't need an institution to tell me that's safer. The way the vaccines are developed, we don't use any virus. We use the genome. We produce the specific code to produce the spike. We're not even saying we're putting a spike in because the protein can be contaminated. It could be whatever. All that is eliminated. All the dirty steps are eliminated. It is just safer by virtue of how it's produced. And then we got the FDA, the CDC, the trials themselves. What kind of science buff says that the mRNA is manipulating the cell, or what did he say?
Yeah, he says he's a science buff, and then he just said it's safer by whose standard, and then he says so then he says my own immune system already doesn't that on its own. All right, so let me hit you real quick. Your immune system does not do that. Your immune system is compromised, meaning that your immune system takes time to develop antibodies against, once it has been exposed to a virus. Now, that's deadlier. And how is it deadlier? Because there's something called long-term COVID. There's something called COVID toes, COVID fingers, COVID tongue, loss of taste and smell, fog, brain fog. There's something called COVID lungs, COVID heart, COVID kidney. These things you expose yourself to when you become naturally infected. Now, the problem is you don't create some type of immunity against this virus because you can get reinfected not once, not twice, but 3 times and maybe even more. And the vaccine prevents you from experiencing hospitalization. It prevents you from death. It prevents you from all of those illnesses. And now we know that it stops you from transmitting it due to scientific studies, Mr. Science Buff. You want to add, Cedric or Malcolm?
Everything you said was on point.
All right. Now he says his second comment was, go ahead, Malcolm.
Malcolm, say you killed it, man.
He says my own immune system already performed that. All right, so we tackled that, so you can get that out of here. Then he says fear is not science. Convince me. All right, I shouldn't have to convince you, and I'm not using fear. I'm not using fear at all. Asymptomatic patient exposed to COVID-19 had a double lung transplant. I'm going to say that slowly. Asymptomatic patient exposed to COVID-19 had to receive a double lung transplant. If you're asymptomatic, that means you have mild to little symptoms. It ended up being bigger than mild to little symptoms because a double lung transplant was required. COVID ate away at the lungs.
Yep.
So that caused this person to actually have it. Now, we can go on further. We can talk about the heart. We can talk about the brain, where it hides up there and mess with your smell and taste. Black lady, 2 kids, reported 6 months, no taste and smell. They got something called COVID long haulers, brother, science buff. COVID long haulers. See, I'm not trying to convince you. I'm not trying to push fear or anything. I'm actually prompting you to actually study something so that you can understand what you're up against. Natural immunity does not occur with the novel virus because of reinfection. Once you see reinfection, natural immunity is out the door. We will not achieve herd immunity without a vaccine. So he says, everyone I know who got infected survived just fine while families survived. Okay, so I just dealt with that, but I'm gonna deal with it. I'm gonna deal with it again so you can understand. COVID long haulers. A lot of people are recovering, but you think about it. There's a 97% recovery rate. What is 3% of 7 billion? That's why we have millions of deaths. We're talking about deaths. So the number of deaths that we have, let's just deal with America alone. You had 30 million that actually been tested, that actually had it, and you have 600,000 deaths. That's larger than a city. I don't know where you from, bro, but that's the size of a city, a major city, depending on what we're talking about as far as citywide go. That's an entire city. That's bigger than my city. I'm in Nashville. That's bigger than my city. That's more than Memphis. That's more than Memphis and Nashville together. And
that's 10 times my population. Yeah, we about 60, 70,000. Imagine.
Yeah. So that now people will survive from it. But here's the thing. I just gave you a great example, bro, when you commented at the 1051 mark that people in your family got infected and was fine. You're right. But guess what? People are fine. Some people are developing saying that they are fine, and then next thing you know, they got a bad cough. Or they got a certain breathing pattern that they can't shake. Because they done developed some form of either bronchitis or asthma. Or some form of diabetes now, because COVID is affecting you to the degree that you're testing for, what is it, type 2 diabetes, I believe, type 1?
Type 2.
Type 2, okay. So we're seeing these in studies. So when you getting into the science, you got to deal with that. Now, he says, oh, okay, hold up. I don't mind. Well, he talking about he ain't going to get on the panel. Heart disease is at 90% survival. COVID is at 99.7. You misunderstand the survival rate again. When you say 90%,
what did he just compare?
He says heart disease is at 90% survival. COVID is at 99.7.
Is heart disease transmittable? Is heart disease a communicable disease that is transmitted via virus?
No.
A novel one? End of discussion. You can't compare the two. That's false equivocation.
He says asymptomatic. We didn't caught up to his comments. Asymptomatic post-infection status. And that's after getting COVID. No, first of all, there's no 99% COVID recovery rate.
Nope.
So you're
with 600,000 dead.
Right. So you're wrong on that point altogether, bro. Secondly, there's more COVID long haulers that been infected a year ago. They got people who got infected with the disease that's still showing symptoms.
Facts.
Letitia in the building. I just got my first shot 2 days ago. No, you need to check your percentages. So, okay, so let's deal with it. Because we dealt with this before. Let's fact check the 98% recovery rate, right? And how people actually misuse this and think that they know what they're talking about. But you're a science buff. So you got to understand that 2 or 3% of a total population, how many people in it? Over 300 million. We're 600-some thousand deaths. That's bigger. So here we go. Fact check. Does COVID-19 have a mortality rate of 1 or 2%? All right. My bad. I clicked on that dang on video. All right, so let's deal with it. All right, now I did it again, y'all. So the claim COVID-19 has a mortality rate of 1 to 2%, and some people shouldn't panic. This is what a Facebook meme says, right? The survival rate of positive pandemic. So its argument echoes Dr. Ben Carson of Fox. We're familiar with this. So what a 1% mortality rate means. The figures cited on social media aren't far from mainstream projections. They even pessimistic about how likely someone is to survive COVID-19, right? So they testified among Congress that the mortality rate may be as low as 1% when accounting for people who are infected. But listen to this. But don't develop symptoms severe enough to be tested. So Fauci, given how infectious the new corona has been proven to be, that is very dire figure. Listen to this. A 1% mortality rate means it is 10 times more lethal than the seasonal flu. Here we go, bro. This is what you ain't saying. I think that's something people can get their arms around and understand. A 99% survival rate might sound promising, but when it's scaled out to the rest of the country, all 329 million residents, a 1% survival rate takes on a different meaning. The attending physician for Congress and the U.S. Supreme Court predicted earlier that the pandemic that 70 million to 150 million U.S. residents would contract COVID-19. A 1% mortality rate at the scale of infection is between 700,000 and 1.5 million dead, roughly the population of Washington, D.C., on the low end of the entire population of Hawaii, and on the high end. COVID-19 mortality rates depend on age, spread of disease. The exact mortality rate of COVID-19 in the United States isn't yet known. Outcomes depend on many factors, from the level of strain on the healthcare system to an effect on a person's health history. And this is another point that you're not mentioning. What about all the people who have been affected, recovered, and are still having symptoms that I mentioned to you earlier? The long haulers. You don't figure in the long haulers in the 99% survival rate or 98% survival rate or 97% survival rate. You're leaving out you're leaving out the people who have been infected, recovered, and still show signs and symptoms of health problems. So we can go on down a little bit further. Stopping the spread environment, we ain't got to get into that. We can go down and get into the actual science. Now, it says here, our ruling partly false. It is true that the overall rate may be around 1% or lower when factoring in those infected by coronavirus who were never tested. But definitive statements about the mortality rate are misleading to the point of falsehood. We ruled the claim that COVID-19 has a survival rate of 98.5% partly false. Based on research, there are too many factors that affect the outcome if people are infected with the new coronavirus to make a blanket statement about mortality rates, a person's age or underlying health conditions, and if there's a capacity in health care systems for proper care, and key among them. Further, too little is known about the disease, including the true reach of its spread. But we know more now. And we know now that we ain't got to deal with the misinformation of the so-called claim regarding the 98%. A person with multiple comorbidities would render residual symptoms in a skewed fashion. I have someone who has been infected that I know personally that I worked with has been infected with COVID-19 twice. And both times they have experienced bad coughs that they can't get rid of, and they don't smoke. I don't need to check my percentages. Actually, that article that I just used is an old article that I already had in the stash. I'm pretty sure that I can get a better article than that. This article was from, and it was published in May 2020. That's when the article was actually published. I put it back on the screen just so you know that I can get a more updated source. I was trying to be fair to you because that's when the claims started coming out. You see that? Updated May 6, 2020. So that's an old source. Now I can update it and deal with that because we have information on long haulers that refute everything that you're trying to complain about. So you're really not saying a lot of anything. You're just saying stuff. He says, I have wild families who have zero residual symptoms. You can't prove that they have zero. You can't prove that they have zero symptoms.
And
You can't.
If he was a science buff, he would know that's anecdotal and that we don't take that information into consideration. That's anecdotal. We need hard evidence. And yes, we're not saying that everyone is a long hauler, but you cannot deny the existence and the reality of long haulers. That's the whole subject here. His family, that's anecdotal, irrelevant.
Right. Large tongue is also anecdotal. What? Large tongue. All right. What I would highly recommend, Michael, is that you go back a couple of episodes and look at a presentation that we did where we deal with the actual evidence. You know what I mean? We don't do speculation over here. We actually deal with the scientific evidence. Matter of fact, I don't even want you to go back. Hold on a second. You ain't gotta watch nothing. Because I'm pretty sure while you here, just because of the type of person that you are, that you know, if you really into it like that, that you would read. And I can see right now you ain't even gonna read.
Nope.
I can see that right now because you said you're a science buff. You can't be a science buff with bad data. It's just a fact. All right, you see that? It's COVID times. 2020, European Society for Vascular Surgery is the source. The effects of catching COVID-19, COVID lungs, COVID heart, COVID kidneys, and more. All scientific information, it tells you right here. Oh, look, published 2/4/2021, SARS-CoV-2, the virus that causes COVID-19 does occasionally infect and damage the heart tissue. COVID-19 kidneys, the effects, June 5th, 2020, in the statement, the National Kidney Foundation reported the acute kidney injury is occurring in 15% of all patients who are hospitalized for COVID-19. Continue. COVID brain from the National Institute of Neurological Disorder and Stroke, NIH, pointing to brain fog. COVID brain and taking a closer look at the COVID-19 effects of the brain, posted January 14, 2021. Recent reported in the Journal of Experimental Medicine. Come on now, science buff. Right?
Yeah, that's going to lead to ischemic strokes because that means that the white blood cell count is getting so high that it's sticking on the brain. Trust me, I know. I got a stroke like that from lupus.
COVID tolls from the Journal of American Academy of Dermatology and JAD case reports. COVID lung and heart, Northwestern Medicine lung transplant program. You got your heart, you got your lung, right there on the screen. Sources, science buff. Screenshot that. Come on, man. Just screenshot it. Do your research, science buff. Down here, you see where it says health, UC Davis. Long haulers. Why some people experience long-term coronavirus symptoms. Long haulers suffer long-term coronavirus. Published January 15, 2021 by the health at ucdavis.edu. Long haulers. Right up under that. JAMA Network. COVID-19 long haulers. We're dealing with long. You didn't know that. My niece had COVID. My sister had it and all that. They all recovered from it. But you don't know the long-term effects on it because many people are ignoring it. They just play it to the side. My friend had it, got over it, and still wanted an oxygen tank because it put him at ease. It helped him with his breathing, but it almost took him out. He went to the emergency room 3 times. And it still took him a while. He couldn't even put he said he couldn't even put a paragraph together. He was talking at work one day and he could only talk like so much at a time before he needed to breathe because he couldn't get out what he needed to breathe. And he really ain't even talking like his normal self. So he just rather text people. But we're dealing with the reality of it all. See, there's a lot you don't know here. So you gotta understand that when you're talking to people, man, we actually do study this stuff. We do study this stuff, bro, and it all starts pretty much with the immune system and how your immune system works. And we all know that because of the immune system, we know it takes too much time. This is old data, but you're talking about killing off a whole bunch of people. Talking about natural immunity. See? This that science right here. Science buff. New variants. Now, you done recover from COVID, but guess what? That South African variant and the UK variant and the South American variant are here. Let you come into contact with it and you get reinfected. Let's see what you say. We already lost one brother in Alabama. He had the UK variant and died a week after. His wife went on CNN.
Oh boy.
As I said, there's no scare. I don't understand. Like, I'm not using scare tactics, bro. I'm talking about actual factuals. No, the one brother is not anecdotal. It's not anecdotal. The brother caught the man. This is news, bro. They found out.
We established the fact that you can die from the variants. How is that anecdotal?
I don't
because
think
your family members are anecdotal.
Right.
It doesn't add up the same way. I thought we were talking with a science buff here.
No, we ain't. I apologize. I apologize. So let's just do it like this, since. Let's do it like this. I don't even want to use it. I don't want to use that. I don't want to use that. I don't want to use that. 8 cases of the UK variant identified in Alabama. This from February. Eight cases, right? And we know one of the 8 cases found is deceased. So this ain't anecdotal. This is news.
That's news. That's hard facts.
This is news. This is what we know of. And we can keep it going. We know. Look. February 16th, U.S. COVID cases by variants. We know the variants. We know what we up against. Now, if you want me to show you the dude died now, I can give it to you. Alabama man dead from contracting contagious COVID-19. That's the post. I can go to Jefferson County where the brother was at and give it to you just like it's. Like I said, the dude's wife was on CNN, bro. It was one of the first rare cases of the UK variant. That's why it made a big deal. His name was Alphonsia Jackson Jr., 35 years old, man. You 50. He was 35. Bro. He had to be 117. We ain't got to make this up.
We're dealing with a 50-year-old that is talking about natural immunity.
Man, I don't know what he's talking about, yo.
Nah, I don't think so. That's some crazy stuff.
Yeah, Mike pump faking. He ain't got no signs. One can die from the common flu. Correct. But because of COVID-19, the people been staying away from each other, so the flu ain't even getting around like it's supposed to.
There you go.
That boy said one brother, Alabama anecdotal. No, bro, we got the science. We got the science.
Anecdotal only works when you're saying my family and have no evidence to support what you're saying. That's what makes it anecdotal. Do you have reports saying there's no residual effects from your family? No. You're giving us what you see and observe. We're dealing with the scientific facts. We know what he died from based on testing. This shouldn't be so hard.
Yep. He says, I'm healthy, 50. I'll take my chances. Good luck to you, bro. I don't have a double-blind study, not facts. Yeah, you don't have it, but see, we do. We do. We got the double-blind. We got the double-blind, bro. That's the thing. What you don't have, we got. What you think you got?
It wouldn't work any other way. We wouldn't want it any other way.
We go for it. We go for it. We got the preclinical trial data. We're well aware of it. We know what we're talking about. We on all of that, bro. We got it. I'm going backwards with you. We talking 3rd generation vaccines. The ones you had was 2nd generation vaccines.
Yep.
And before that, 1st generation vaccines. See, we with you. We trying to help you. If you're a science buff and you don't have any clinical data, but we have it. We got it. We got the beginning, the preclinical trial data right here. And then we can pull up the clinical trial data from Moderna, Pfizer, and Johnson & Johnson. We can do that. See, you saying your family members. My family members been infected too, and they recovered from it too. But we don't know what lasting effect it have on them because people just ain't going back to the doctor and getting tested like that or trying to figure out what it is. They went in quarantine and then they chilling out. But let them come across a new variant and they get reinfected.
My girlfriend is a speech therapist. She was born with a heart condition, got surgery and everything, but she was in the high risk group. She got COVID. She got it mildly, but she still complains that it takes too much out of her to go a whole day. She is still feeling the effects of COVID. Now, she got her first shot also. She was infected, has antibodies, but still got a shot. Go figure. No one wants to play with COVID. Prevention is always better than a cure. I don't understand the logic behind I'll take my chances. I guess he also takes his chances in the car, doesn't drive with a seatbelt. A risk taker, I guess. Doesn't make any sense. The science is sound. Vaccine development is only going to go faster. Cancer treatments are going to come out of using mRNA technology, messenger RNA technology. It is the future. What we're now seeing is that using messenger RNA technology, there's automatic cell death. So one of the receptors produces a protein that automatically kills the infected cell. You know what this means for cancer? Direct targeting.
What do you say? Vaccines go past the check and balance of the liver. What? I can't risk that. In this case, it's an mRNA generation 3 situation that's not sufficiently. It is sufficiently tested, bro. I just put on the screen. Michael, I just put on the screen. Let me do it one more time. This is how we know it's sufficiently tested. So let's just deal with that for a second. Let's deal with that. Here we have all 3 vaccines that are right now going around the United States. Here is the pre-clinical trial data. The pre-clinical trial data. This pre-clinical trial data involves a rhesus monkey. So we got a non-human primate, 2 non-human primates, and then we got a hamster. And before this, we got mice.
Yep.
So there's preclinical trial data that shows that this goes through all 3 phase testings. What's your rebuttal to that? Let's see the rebuttal. So we got the preclinical trial data, we got the clinical trial data, and you're telling us that this is not sufficiently tested? What's your rebuttal? I just want to see the rebuttal, bro. Cause you scared to get on here.
Same here. I'm waiting. I think the most people have a problem with the fact that vaccine was developed so quickly. Technology. We're only going to start developing vaccines faster and faster. This vaccine went through the same trial phases. It went through all the same trial phases. If it didn't work on mice, it wouldn't have gone to the second to a primate. So it wouldn't have reached the human testing if the preclinical trials didn't show the effects. I just don't get the logic.
Hold on, let me deal with something real quick. Daryl Blue, that's not a fair question to ask because it has been approved for emergency authorization use. So that kills that right now. People don't even realize what an approved by FDA means. It's been approved by the FDA for EUA. So Michael says real quick, yeah, he isn't interested in evidence, Rasta. He says, not enough testing for me, be even close to confident. 9 months is weak. Actually, there's more than 9 months of testing. They are at a year in testing, Moderna and Pfizer. So that's over a year. So what's your rebuttal to that? That is plenty of time, because if you was here early in the show, we had one of the lead epidemiologists, immunologists in America tell us that vaccines normally take 1 to 2 years. This one allows time for it to be. Hold on. Let me start over. Michael, this vaccine science has been studied for 30 years. Since 1995, they have been studying this technology to advance vaccine science. Since 1995. Now, a year is not a joke. Add 29 more, because that's how long they've been working on mRNA technology, for 30 years. Okay,
that's a fact, Shawn. When I was in college, we were the first.
Hold on, Cedric, you gotta deal with this one. You gotta do. So let's deal with this one real quick, and then you can get into it. So Daryl Blue says it's not approved. It's approved for emergency use authorization. and it will be approved for BLA use. I will tell you that right now. He said, didn't you say it takes 10 years? No, we have never said that it takes 10 years to make a vaccine. First generation, second generation, third generation have all shortened the time it takes to make vaccines. First generation vaccines, depending on what type, could take 20 years. Second generation vaccines was between 2 to 5 years. And then it got short to 1 to 2 years. mRNA vaccines, we like that because it's much quicker, bro. All they need, and Cedric already explained that quicker. So we going backwards here in this conversation. Now, then they should have a vaccine for HIV. You can't have a vaccine for HIV because if you knew science, Mr. Science Buff, you would clearly understand that HIV is hard. It's hard for them to make a vaccine for that because it kills the necessary things that is required in order to create an immune response against it. So go ahead, Cedric.
Yeah, I was saying you're factually right. 30 years. When I was in college, we were the first generation that started extracting DNA out of meat and doing PCR. It was rudimentary at the time. We did Western blotting. It took forever. Now, 30 years later, machines read and produce PCR, polymer chain. So we can take a piece of DNA and replicate that up to the point that we can now use that to identify viruses. Use that technology, we can produce we can produce all proteins we want on a machine. It's that easy. We can do it within 24 hours. So to develop the vaccine was like exponentially faster. The vaccine was ready in months. The actual vaccine was ready in months to be tested. It is not like first and second generation where we have to grow the actual virus in eggs or in other animals. That whole process has been eliminated. This is what people don't understand. The time frame has been drastically reduced, but we're still doing the same trials. Look at the amount of people in the test trials. This, for the first time in history, there has been such a large group in each phase of the trial. All of this argumentation is null and void. I mean, we've been through this right here on the Masiwara clan. I sat and watched the whole show. This is all redundant. And as for approval of the FDA, again, money, financing. So we had to go through the military spending plan. That's why it got this Operation Warp Speed name. It was to make the money available. The vaccine was approved for fast track based on the results of the trials. Yes, all the information is still being collected and will be collected for the next 20, 30 years, but doesn't mean the vaccine isn't safe and effective now.
All right, let me show this real quick.
Well, the U.S. government called it Operation Warp Speed. Remember that? For the pharmaceutical industry, the development of the coronavirus vaccine was a unique challenge because it had to be done so quickly. Well, a new documentary preparing tonight on Nat Geo takes a close look at how this was achieved, a huge accomplishment by the industry. Entertainment reporter Sandy Kenyon has a preview. Sandy.
Liz, it's called Mission Possible, the race for a vaccine, and the documentary offers viewers unprecedented access to history in the making last year. The pharmaceutical industry is known for being secretive and very competitive. So why are cameras being allowed in here? And why is the CEO of Johnson & Johnson prominently featured in a film paid for by Pfizer, one of his main rivals?
There's so many things I never believed I'd see that I'm seeing today.
Sally Sussman's decision to open Pfizer's labs to TV cameras is as unusual as the development of the vaccine itself, says the guy in charge for Nat Geo.
You know, before we sort of commenced, I questioned what we'd really get access to. But credit to Pfizer, they backed up their need to tell the story.
A once-in-a-lifetime story about the development of a vaccine in less than a year, when the process can take 10 times that long.
You have an open checkbook. No questions asked.
But despite the promise of Pfizer's chairman, there was no guarantee of success when filming started.
There were so many nights I couldn't sleep over the idea that we have opened the whole place to this film crew of Nat Geo.
Producer Mike Weesey told me even the scientists weren't sure this could be Mission Possible.
They were just as uncertain as everyone else. And they share that, and we see that.
But still, they worked long hours and gave up time with their families to get this done.
The singular lesson that I take away from Pfizer's response to the pandemic is take the risk. If you don't take the risk, you'll never have the reward.
Mission Possible was created for Pfizer in collaboration with the company, which also paid for it. The documentary airs on a network that's primarily owned by Disney, the parent company of ABC7. It all starts tonight at 10 p.m.
All right, so that's a little information right there that y'all need to know. So we know tonight that it's on Nat Geo. We can get into all of that. However, we also are aware of vaccine science. We understand that in order to make the vaccine, all they needed was the genomic, the sequencing. That's all they needed because they already had the technology. All they needed, I'm going to say it slowly, all they needed was the sequencing. And yeah, this is redundant, and I heard you say it a couple times, Cedric, that we've already covered a lot of these things that people are just continually to throw over and over and over and over. Okay, so let's deal with Daryl's question because he keep asking off the wall. I don't know why Daryl be doing this sometimes. Okay, my question, Shawn, how do you know you are not receiving a placebo? Is that considered belief or you just know what's going in your arm? Daryl, the vaccine trials are over with, brother. They are not doing placebo vaccine runs. These people have the government has cut a check to Pfizer, Moderna, Johnson & Johnson, and all the other vaccine companies involved in Operation Warp Speed to create a safe and effective vaccine. You know that you're getting the vaccine because you will feel the results. You know that you're receiving the vaccine because of the robust response from the vaccine, especially when your body begins to create antibodies.
Yep, my nose has started running already.
You don't have people producing antibodies, bro. We know because we know. Dude, they have limited amount of vaccine availability. They are not giving you, listen, Kroger administered like 11 shots to some people who didn't receive it. They called the people back the same day and says, we made an error. You did not receive the vaccine. Kroger said that. This is public news. So again, I'm going to slow it down. Daryl Blue, they are not, bro. People are having adverse effects, which is a good thing because we know, some people are going to have adverse effects. We know people are having mild and limited. No, I'm not sending you no link because you sound crazy as hell. We know people have mild symptoms from the vaccine. We know we're getting the vaccine, bro. It's just like when you had to get an MMR vaccine to go to school. when you had to go get your first flu shot or whatever shots you had in your life. You know, the science says you know. We know what we're getting. You see it go in your body. White people are paying $25,000 to skip a line to get a vaccine. White people have dressed up as old people to get a vaccine. White people have taken the vaccine from places to administer the vaccine to their family members and friends. Some people call people to come get the vaccine so they didn't waste vials of the vaccine. You're telling me that people are going through all of this for a placebo? I do know, Daryl. How crazy does that sound, brother? You sound crazy. I ain't listening to him. I ain't even looking at him no more. Boy, you crazy.
That's just crazy. At this point, the trials are over. The vaccines have been disseminated all over the world. People know exactly what day they got to go get the second shot. What? Trials are happening in controlled environments for the reason of them being a trial. At this point, the trials are over. We know what the vaccine does. People are just being vaccinated.
Dude said, this is not like the MMR. Mike, you done, bro. We done with you here. We sent you the link 5 times. We done with you here. You're absolutely right. It's not like the MMR vaccine. It's better. It's so much better that I'll be getting my Moderna shot in the morning.
There you go, Shawn. Like I said, I got my Pfizer shot today. I'm proud. I feel good. I made a video. I put it out so everybody could see.
We don't think you got it. I ain't seen it. Where your card at? Pull the video.
I got my card. I got my video. How can I?
Nah, put it on the screen.
Put it in the back chat.
Put it on the screen. Let me. No, I'm finna go on your page. We don't believe.
You want to go on my page? You gotta go on Soliga K9. And let me see if I can put it in the chat.
I just give me a message. Just send me a message. Let me see what Chavis was talking about. Chavis then went ahead and went into the long haulers. Oh, I ain't even get to that, Chavis. I should have put that on the screen, huh? Let me put that on the screen. Let's beat up the pseudo claim some more. Let's beat up the pseudo claim some more. Watch this, y'all. Let's beat up the pseudo claims. All right. Causes of long-term health problems. We are also getting better and better picture of long COVID. We know this. Post-acute sequel of SARS-CoV-2 infection. Yeah, we know this. 13.3% of the people have symptoms for more than 28 days, which is the definition of long COVID. 4.5 had symptoms 8 weeks, 2.3, 12 weeks. Interestingly, they found that certain groups that have higher likelihood of long COVID, patients with more than 5 symptoms during the first week of COVID-19, old patients, 70 years old, compared to 18 to 49. We got all that right there, the Journal of Nature. Yep. You sent it to me?
I put it in the back. I put it in the chat.
Oh, okay, hold on. Let me pull it up.
My Facebook info. I put it in the chat.
Yeah, you put it right here.
Video right up there.
I got it. Let me pull it up. I thought you was gonna share your screen.
I'm on my phone.
Oh, okay. Where your card at?
My card. Let me put a pic in the chat.
I don't think it's gonna let you do that.
Yeah, no.
Boom, 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 boom. Oh no, let me put it on the screen. I got your video right here.
There you go. I am going to put my money where my mouth is.
Oh, yeah.
I've been a vaccine advocate from the jump since last year. I was promoting vaccine before we had one. I've been a proponent of the vaccine. I don't see the obvious objections. So I'm here right now doing it. You gotta put your money where your mouth is. I gonna be safe. How about you?
Okay. Sorry. Don't massage the area and don't put anything warm on it. You can put something cool on it. If it gets to bothering you too much, you can take some paracetamol for it. Some symptoms that develop are cold-like symptoms, so cough, runny nose, fever. You can also take paracetamol for that.
No, I'm not. I'm not gonna take.
Oh.
I'm not gonna suppress my immune response.
Okay.
I'm gonna take it like a big boy. You see, don't take no paracetamol, sick it out. You know why you're sick. Right? Immune responding properly if you get a little sick.
That's right.
So be big boys and big girls. There you go. There you go. See, I'm all tatted up. I can't complain about a shot. She is smooth. She's very good. I didn't feel nothing. That's it. That's what big boys and girls do. I'm vaccinated, folks. Thank you very much. Have a good day.
All right, let me deal with okay, so Daryl, let me answer your question. This is the last thing that I actually say in acknowledging you right now, because we're getting too far into the video. However, they study vaccines every year because they need to see the science and update the science. What am I saying? That the long-term effects on any vaccine isn't determined. Why? Because a virus can mutate. Are you not paying attention to what's going on outside? Viruses mutate. You have different strands or you will have different variants. If a virus mutates and it turns into a different strand, that is a problem. This is for all viruses. This ain't just because of COVID-19. They've been studying the science of this vaccine this whole entire time. This is why Moderna came out and said 6 months ago, hey, we're proud of our vaccine. Our vaccine, we're showing immunity over a year. See, you keep asking for certain things that you don't even understand. You just asking. You just saying. We know a lot. We know a lot you don't know. So tomorrow, I gotta go get my vaccine. Tonight, y'all laugh at Daryl Blue trolling in the chat. No, you don't. No, you don't, Daryl. Because if you knew, you wouldn't be saying the stuff that you're saying. Okay, yeah. And I do understand. That's why I'm asking. No, you don't. Because if you did understand, you wouldn't be asking the question. Because because things keep evolving. Pastor. Oh, okay. Now you're emotional. I ain't even gonna let that comment survive. I ain't even gonna do that to you. On that note, man. Look, Cedric, I appreciate you, bro. Appreciate you coming.
I appreciate you, Shawn. Thank you.
We'll catch you on the next
episode. We gotta keep doing the work. Our people need the vaccine the most. It's affecting Black people all over the world. We're getting hit hard with this, and we look absolutely ridiculous as a people, being scientifically illiterate and running away from a vaccine that's gonna save our lives.
We don't know the long term. Boy, you crazy. You don't know the long term effects of deodorant. You don't know the long term effects of toothpaste.
The long term effects of the vaccine would mean What would be the best long-term effect? That the vaccine creates immunity for longer than a year. We know for a year now for sure. If it does it for longer than a year, we'll know that next year. If it's longer than 3 years, we'll know that the year after. And the longer the vaccine works, the faster we reach herd immunity. A vaccine is going to stimulate your immune response. That's what it's going to do. The long-term effects of you having an immune response means I'm long-term protected against COVID. What?
I ain't even looking in the chat no more, bro. All right, Sage, appreciate you, bro. Have a good evening.
Appreciate it. You too, Shawn. Peace.
Log in to KofiPaisaTV.com and get Spears of the Mossy Volume 1 by Kofi Paisa Research Team, from Spears the Pen Volume 2 by Kofi Paisa Research Team, Spiritual Combat Volume 3 by Kofi Paisa Research Team, One Night Before Bed by Any Harret Shawn Calfunny, Kalawa's Trip to the Motherland by Kofi Paisa, From Cocaine to Consciousness by Any Harret Shawn Calfunny, As I Learn, We All Learn by Kofi Paisa. Also, if you want fresh merch, go to our online store, Family Connect Apparel, and get all the brands. Also, get our 54 deck of quiz and educational cards available now on KofiPaisaTV.com.